That's us recording now.
Thank you. Thanks, Neil. And welcome to the meeting of East Lothian Integration Joint Board on the 19th of December 2024. The meeting is being recorded and will be made available as a webcast in order to allow the public access to the democratic process in East Lothian. East Lothian Council and NHS Lothian are the data controllers under the Data Protection Act 2018. Data collected as part of the recording will be retained in accordance with the Council and Health Board's policies on record retention. The webcast of this meeting will be publicly available for up to 6 months. I'll pass this on to yourself, Clark, the apologies and roll call of attendees.
Thank you, Chair. We have apologies today from Darren Bradley, and I'll now take a roll call of the IJB members present. Shameen Akhtar.
Present.
Jeremy Finlay.
Present.
Lynn Jarden.
Present.
Carol McFarlane.
Present.
Jonathan Blaseby.
Present.
Patricia Cantley.
Present.
Andrew Cogan.
Present.
Elizabeth Gordon.
Present.
Maureen Allen. David Binney.
Present.
Lindsay Byrne. Sarah Gosner.
Present.
John Hardman.
Present.
David Hood.
Present.
Kalonde Kasangeli. Claire MacDonald. Claire McIntosh. Marilyn McNeil.
Present.
Thomas Miller.
Present.
Fiona Wilson.
Present.
Thank you. Can I ask if any members have any declarations of interest on any item? No? Thank you. And before we begin the business, there's a resolution in relation to item 12, the IJB formal approach to partners. On the agenda, it states that it is anticipated that the IJB will agree to exclude the public from discussion on item 12 as it contains exempt information. Do members agree to consider this item in private? Just general agreement is fine.
Yes.
Agreed.
Thank you. We're now ready to continue with the business, Chair.
Thank you. Just before we start, I just want to welcome Mike Porteous, who's here and who'll be mentioned in the papers as Finance Officer. And I just want to welcome Councillor Dugdale. Our meetings are public meetings and members of the public are able to attend and listen in, as in all other NHS Lothian and Council meetings. They're observers and can't ask questions or make comments. Okay, move on to agenda item number 1, which is the minute of the last meeting, which is the 24th of October. Can I ask if there's any matters of accuracy or reflection from the last meeting? Everybody will have read them, just to check if you have any. Councillor Jarden?
I think in relation to the item where we discussed the reserves, I think it was an important question that I'd asked around relationships, and that doesn't seem to be accurately reflected in the minute.
Okay, thank you. Fiona, if I could ask for the section on finance to be expanded to reflect the discussions that took place at the last meeting.
Yeah, I can do that, and I can, if members would prefer it, I can rework that section and then recirculate the minute at the next meeting for approval, or members can approve it subject to amendment. It's entirely your decision.
Okay, we can approve it subject to amendment. That'd be okay. But I think it's really important to reflect. We had quite a detailed conversation around the finances and reserves, and it's really important that's reflected because these minutes go out to our partners and they need to be fully aware of the discussions that took place. Thank you. There's not any other matters of accuracy on the minutes. Oh. Okay. We would just go through them for any matters arising. Anything on page 1? Page 2? Page 3? Page 4? Page 5? Page 6? We had our discussion on Musselburgh Day Centre, and I'll reflect a bit more in the chair's report of what I picked up. I've been out and about. It was just to ask if you had any timeframes for that. I know we had that discussion around pausing Musselburgh Day Centre. Laura Kerr?
Yeah, so just as we reflected in the last meeting, I would expect, and know the officers are working on it just now. I would expect them to have a report with later in January that would bring back again about the whole review of day supports for older people. So I'm looking for them to bring something back at the end of January.
Okay, thank you. Anything else on page 6? Page 7. One of the areas brought up on page 7 was COVID vaccinations and carers and their opportunity to be vaccinated. I wonder if there was any update on that issue. Laura Kerr?
So I'm not aware of there being any update, and this is obviously set by the JCVI. Yeah, thanks for that. So no, so I don't think we were due to bring an update back, and obviously it's set nationally and not through a local decision.
Okay, so at the moment, carers don't have access to the COVID vaccination, and that was the issue. I think it was David Binney, our carers representative, had raised that issue.
Yeah, and I think that's in line with the JCVI guidance for this year.
I think at the meeting we were, you can correct me if I'm wrong, David, you were noting that would have a negative impact because we rely so much on carers to provide that support, and them not having the COVID vaccination would have a negative impact. Was that correct?
That's correct.
Yeah, I think if we could keep that a note, and so that we're keeping an eye on if there's any expansion from the group that decide the vaccinations, and a way that we can relay the concerns our carers representative has highlighted about carers not having access to the COVID vaccination. That would be helpful. Okay. And then anything on page 8? Just one final thing on page 8. I think I'll pass it on to yourself, Fiona Curry, for expansion on the discussion. I think one of the points I'd made is that we didn't want to see a reduction in the day services provision that's provided in our local communities, and I think that was an important note that I wanted included in the minutes. Okay, anything else on page 8? I think that's it. We're happy to agree the minutes. You see a general nod of heads. Yes, thank you. You move on to agenda item number 3, which is the chair's report. I was asked to provide a written report at the last meeting, so I tried to summarise as much as possible. I won't go through the whole report, and I'm happy to take any questions, but just some standout points for me where it's been a really busy time, and I've been really grateful for the opportunities that groups have invited me along to, whether it be their AGM or visits to their projects. And I think one of the reflections of this was the network of day centres. One of the things they had highlighted was how are IJB members aware of the activities and what's happening on the ground in East Lothian. And I think this is one way of getting that across, of the plethora of activities that are happening that also directly link in with our strategic objectives. Just some of the standout points were Musselburgh Day Centre. I think there's quite a few events where I met health and social care staff, and they were just relaying their feedback on the importance of having local services. So I had examples where NHS staff said, I've got no option but to send somebody to A&E because there isn't local provision for me. And their specific example was a day centre in Musselburgh would make a significant difference to their work, because then they'd be able to pass them on to a local support, provide local support for that individual rather than send them to the hospital. And the example they gave me was they had an individual who was phoning the ambulance service half a dozen times a day. They arrived at their house, a paramedic was there at 8 o'clock in the morning, and there really wasn't necessary for them. So they had to then find another support for them. So what they did was they contacted a day centre, not in their local area, but nearby. They provided that individual with 2 days at that local day centre, and that just meant they were, life was much better for them. They were no longer having to contact the ambulance or the GP services half a dozen times a day. So those were just some of the examples. It was passed on around the importance of having local community services. There's a small paragraph on Signal and Volunteer Centre East Lothian, and it's a shame Maureen's not here. And I think it'd be important for us to look into having a development session to better understand the Signal, which is around how do we make sure we're getting accurate information about the needs of people, and how are we making sure that we are providing services that actually meet their needs in real time. So I've not explained it very well in a couple of sentences, but I think it'd be helpful to have a development session, because I know some of projects like Community First have been participating with Signal, and they're starting off in working with the voluntary and community sector. But in the longer term, it's to provide a more accurate picture of what our local residents are looking for, what the challenges they're facing, and how we invest in and develop the services that best meet their needs. The issues that were, I think it was Trish, you'd raised with me the importance of bringing to attention the issues and challenges that we face to national politicians. So in the report, there was a couple of times where I'd had the opportunity to raise directly with Neil Gray, the Cabinet Secretary for Health. One was at a meeting with the GP practice in Preston Pans, and the second one was attending a meeting of chairs and vice chairs of IJBs. And at both opportunities, I made the point of the good work that's happening within East Lothian IJB on the ground, but also the challenges that we face, and the importance of making sure that we support community interventions to stop people from going into hospital, but also supporting the health service. So that example of the person going into a day centre, that means those paramedics and the GPs are then have their time freed up to be able to provide support to other areas where people do need it. So just to say to Trish, I took both those times took that opportunity to raise the challenges that we face in East Lothian as well. So I hope that helps to answer your question around bringing it at a national level. The other thing I just wanted to mention was the network of day centres, and the feedback that they gave was that they welcome anybody from the IJB visiting them. So you may receive some correspondence from them asking you to go out and see them if you want to. And they were really keen to highlight the services that they provide, but also they wanted to make sure that IJB members were fully aware of what local services were being provided out there. And the other things around our housing, that was quite a big issue. And we'll touch upon the housing paper later on. Housing was raised at a number of occasions at the Mid Lothian and East Lothian annual general meeting for Women's Aid, and the discussion that we've had around homelessness as well, the importance of having a safe, secure home, and that means that you've got less health interventions and you're supporting that person's health and well-being. So that came up quite a lot. And finally, I want to mention Ross High School's 70th anniversary, and the reason why I mentioned that is at that event I met a very large number of carers who were supporting their family members with dementia, and that afternoon for them was an afternoon of respite, because their family members who had dementia were able to recognise themselves and their friends from school. And so for the carer that was there, that was a really, really powerful, enlightening afternoon for them to see the person that they were caring for in an environment where they were able to recognise people and engage with other friends that were there and while they were at school. So I'm really grateful to Paul Reynolds from Ross High School for organising that. I think I will leave it at that, but if anybody else has any questions around anything on the Chair's report. Jonathan?
Thanks, Shameen. It looks like you've had a busy time, so thank you for that. Looks like you've a lot of very worthwhile visits you've made, and spent quite some time summarising it all for us, for our benefit. So thank you. It was really just, could you just dig in a little bit more about your conversations with Neil Gray, please, in terms of, because obviously the context and Patricia's comment, I think others also at the last meeting, was really around the very difficult decisions and discussions we were having in these IJB meetings. And so I think it was around those difficult decisions we were asking to be raised with central government So I'd be interested in what specifically you raised with him in terms of that, and also what he said, more importantly, perhaps in response to what you were and maybe other IJB chairs were also raising at that network meeting. Thank you.
Thank you for your question. What I raised was our demographic growth and our rise in need for provision of services, but at the same time our financial challenges. And how I raised that was in the context of their work, because what he was there with the civil servant to present was the rescheduled care work, which we'll see later on in the papers. So him and his colleague were there to say, look, this is what we're doing. And we said, okay, we recognise what you're doing, but you must look at the whole picture, because this is not fully going to answer or solve the problems that we have. But what will help to answer and will help to address some of the problems that you have is the involvement of IJBs and the IJB services that we provide. And if you invest more into IJBs, that will help the whole bigger picture. So it was in that context. I think I wasn't the only one that raised those financial challenges, so I think that's really clear to him. And also we were really keen. I said to him something that Trish had mentioned to me about changing the narrative, that we can't always be talking about hospital beds, and that we must change that narrative and talk about local community interventions. He kind of acknowledged that, but didn't say it a huge amount as a result. But I think there's a little bit of, we'll see later on in the paper on the rescheduled care work that's going on. You'll see a little bit in the paper about there is some acknowledgement about social care in there. So I think there's absolutely no doubt that he is fully aware of the challenges that we face. Because I said that if we continue in the way that we are, then we won't be able to deliver the services that you need to be able to support the system, and that will make the whole system even worse. So we know it's bad right now, but a reduction in finances and support will make the system even worse. And that we can provide, we've got really good examples and really good work happening on the ground where we can support you to address those challenges. So I think he's left with no doubt after the Preston Pans meeting, where I had the opportunity again, and then at the chair and vice chair meeting, to say, look, we're part of the solution for you, but we can only be part of the solution if you're making sure that we're funded adequately, because we can't hold on to everything that we've got without that sustainable funding from you. So I think he's really clear about where we are and what happens now, because we're deciphering what happens as a result of the budget process, and we're hoping that we will get additional resources, that there has been some acknowledgement of being listened to.
Okay, thank you.
I hope that answered it. Is that okay? Carol?
I've probably answered this, you mean. It's 3.3 in EL, the over 75 age group is growing, and what does that mean for future budgeting?
Yeah, I kind of relay those figures to Neil Gray and at our representative bodies as well, that what that means is that there's a rise in demand for services, and so we need to be funded fairly to be able to provide that support. But that's a growth in population, which is a good thing for us in East Lothian, but we just need to be supported to deliver those services. And I think I've taken every opportunity that I possibly can to raise that, so there shouldn't be anybody that is not aware that East Lothian is one of the fastest growing areas in Scotland, but also our funding level that we receive doesn't meet the needs of the growth in population and the growth in services.
Right, thanks, Sinead.
That helped answer it. Thank you.
Yes, it has.
Councillor Jardine?
Thank you, Chair. Thanks, first of all, for responding to my request at the last meeting for a written report. I think it certainly gives us a much clearer feel for the work that you're involved in, and obviously gives us the opportunity to think through any questions we might have. I suppose I would also maybe want to join in this discussion around engagement with CABSEC. Totally appreciate everything that you've done around the conversations. I just wonder actually if we need to back that up with something in writing, because often, as you'll know, these situations are probably handled less by the politicians and more by the civil servants. So obviously a letter gets to those desks as well. So maybe just to sort of, you know, back up the conversations you've already had, and obviously we'll have discussions further through this meeting, but maybe bringing that more to life for the team at the government rather than just the minister.
I appreciate that. Thank you, Councillor Jordan. I will do that. We'll pull together a letter, and I suppose that's timely as well as we're going to the budget process to be able to say, look, these are the things that we can raise. I'll put that down as an action point. I appreciate that. Thank you. Do you have any other questions? Jonathan?
Well, just follow up from Lynn's point there. I think, you know, let's get back to this at the private session, right? Because we're talking about that letter. That could be the letter. That all the work might have been done there in terms of a copy into the people that Lynn is referring to there. So maybe we can come back to that later.
Okay, that's great. Okay, thank you very much. Move on to agenda item number 4. Is that yourself, Hannah and Wendy? The housing contribution statement 24 to 29.
Perfect, thank you. Thank you for having me. I'll try and keep it quite brief. So housing contribution statements are statutory documents. The statement is best thought as a bridge between the local housing strategy, or LHS, and the IJB strategic plan, focusing on shared outcomes, actions, and investment decisions. The statement will sit as a supporting paper to the IJB's 2022 to 2025 strategic plan and any further plans until 2029. The development of the statement was timed with the adoption of the LHS 2024 to 2029 earlier this year. The statement addresses general challenges which are impacting the demand for and delivery of services within housing and health and social care, including the increasing population, constrained funding, and East Lothian's rural geography. The statement also focuses on groups who are more vulnerable to poor health and housing outcomes in line with guidance. The challenges which East Lothian is currently facing includes the critical pressures within the council's homelessness service, East Lothian's ageing population, coupled with increased labour and material cost, have placed critical strain on the funding of major adaptations, and the shortage of social care staff having a direct impact on delivering care at home packages, particularly in the more rural areas. So these challenges all impact physical and mental health. For example, those who experience homelessness have some of the poorest health outcomes in our population. Living without necessary adaptations can increase the likelihood of injury both to the person and any carers, and can leave people homebound, which increases the likelihood of social isolation, which is highly detrimental to health. And the lack of affordable housing for carers will result in higher referrals to care homes and more demand for inpatient care. The housing contribution statement sets out a range of actions which contribute to increasing the health and well-being of East Lothian's population. Actions will be monitored by the Housing Partners Board, and the Health and Social Care Partnership are represented on this group. And there are also plans underway to set up a specialist health and housing group. With the context of changing legislation and reduced budgets, the housing contribution statements is really an essential tool to enable joint working and to target resources. And I'm happy to take any questions on the statement.
Thank you, Hannah. Can I just open that up for questions and then follow that with comments? Councillor Jordan?
Thank you, Hannah. It was a really good presentation of a really complicated set of information. Kind of want to talk to you around what you're indicating at 2.3 in the report around an existing IJB direction. Just wondered what you should know this, but it's not presented in this report. So can you just remind us what the existing direction is in regard to that? I know that we previously had a direction around extra care housing, which was removed, and I don't know that I've got a sense that that is somehow specifically picked up in anything around the strategic landscape any longer.
Thank you for the question. So this action is really to just ensure that the directions are updated to represent what's in the housing contribution statement. Laura might be able to say more to that, maybe.
Laura?
Sorry,
Yeah.
Laura.
It's okay. I was drastically trying to get to the directions policy. You're right, Lynn. It's not in there now, and I think the direction that's in there just now is with regards to a more broader support from housing in relation to housing models to support LD and mental health and older people, but it doesn't specifically reference about extra care housing, as that was something that was felt that we wouldn't be looking at or working with housing on. We were looking at more mainstream housing that we would make sure had in some cases, a sort of core and cluster effect, and could then be returned for mainstream housing as opposed to specifically adapted housing. So that was the direction we're going in. But as you've said, and as the paper says, we are looking to rewrite that direction, and just currently working with housing colleagues to look at what direction needs to be written now, bearing in mind the challenges that housing are facing as well, and just to make sure it's realistic and deliverable for both partners.
Okay, thank you.
All right, thank you. Councillor McFarlane?
This has probably been answered at 314. Most people wish to live as long as possible in their own home. What is the pressure on housing to deliver suitable homes that can be easily adapted for these older people with mobility and health problems? And I've had a lot of people in North Berwick who are no longer able to live in their homes and would like housing available that they can buy to live in. And quite a few people are having great difficulty living in the homes that they are already in.
Thank you. Yeah, it's reflected in that paper. We do know what was evidence that was gathered through the a lot of work that was done for the Planning for Older People services, that more people are wanting to live in their houses as long as possible, especially in more older homes. This could be this is difficult to do. We understand that is something that needs to be done, but again, there's such that pressure on fundings and budgets that is quite difficult to deliver, and new homes are developed to certain standards which allow for that to happen, but again, there's such a high demand for this. And Wendy, I'll let you come in with a much more succinct answer than what I can give.
No, you did very well there, Hannah. So thank you. I was just going to come in and supplement some of that. So, Councillor McFarlane, as you say, I mean, I think we've got a housing needs and demand assessment. We've done a lot of shared needs assessments around specific client groups, and we're very aware of the challenges around our growing ageing population and the need for appropriate housing. I think as a local authority and that strategic housing authority role, you know, we've got a lot of influence over affordable housing providers, specifically in terms of what, you know, the standards of their new builds. Also within our own stock, you know, we're completing a lot more in terms of adapting, extending, you know, medical adaptations as well. But the private sector still, you know, poses some key challenges, and we're working very closely with our planning colleagues at the moment in terms of the development of the next local development plan. And government have asked as well that, you know, a proportion, we actually set a target for wheelchair type accommodation, you know, so more ground floor, more level accommodation that's suitable for older people as well. Now, that's going to be a challenge to enforce that. And as a housing team, we are currently embarking on what we're calling a local investment framework, and that will be looking at housing need in key local, you know, like a housing need and demand assessment for local areas. And the evidence that comes out of that will hopefully help our planners, you know, give them some more weighting to enforce more of this type of housing across the private sector. The other thing I'd maybe add to that is, you know, as Hannah rightly pointed out there, you know, we've got huge challenges going forward in terms of being able to meet the wider needs and demand across the county for all tenures. And as an affordable housing provider, we're looking at different affordable tenures. So it'll not just be sort of council rent and housing association rent, but also looking at mid-market rent, and also potentially, you know, we're already delivering low cost home ownership, but also potentially looking at housing for sale. So hopefully that helps answer that question.
Okay,
Can I
thank
just
you.
compliment Wendy on the production of a very readable and informative document? It's the first time I can see I actually enjoyed reading something. Thank you.
All credit to Hannah there, Councillor McFarlane, but thank you.
Well, thank you, Hannah.
Thank you.
Thank you. Jonathan?
Yeah, hi. Yeah, thanks, Hannah. Wendy. I guess this is just a question on the funding piece of this. So this is section 4 resources, and the table you've got there, which shows to spend. And I'm just trying to understand, I mean, obviously the biggest piece of this is the new affordable housing part. I can't say, but I fully understand what delegated versus non-delegated means. But the question is on that new affordable housing line, where we seem to have seen a big drop. I mean, 10 million plus drop this year in spend, or the budget. And I just wondered why that was. Is that linked to just the supply side of things, and therefore you haven't got the supply, you haven't got the spend, or was it just budgeted for that way? Maybe there was, I don't know what the answer was, but that's, given we're talking about a housing crisis and supply issues, I'm just concerned about that drop this year in that spend. It's a third or more. Thank you.
I'm happy to come back
Yeah,
in
that'd be
there.
great. Thanks, Wendy.
Yep. Okay, so the affordable housing spend, it's very difficult to look at that on an annual basis. So we really look at it over a 5-year period. So housing development, it's difficult because it's quite fluid, you know, in terms of when you get site starts and when they complete. And there's an awful lot of carry forward. So it's quite complex in terms of how that's done. So I always prefer to look at that as a 5-year budget. We have had to reprofile the programme though, because of the reduction in government subsidy towards affordable housing. Now, obviously, you know, there's just been a recent announcement that there's been a bit of a reversal there in terms of the funding that's going to be available for next year, albeit that is just a 1-year additional sort of funding pot. So the team are currently, since the production of this housing contribution statement, the team are currently away reprofiling that programme to see if there's any potential opportunities to accelerate a couple of projects next financial year, you know, to make sure that we're fully maximising any government subsidy that's available. So I'm not sure that it's a very complex tool. I'm not sure if that answers your question, but as I say, I would always look at it more on a 5-year budget as opposed to an annual budget.
So maybe looking more at actually the number of units is more relevant.
Yes,
maybe,
yeah.
Or let's be say it's timing differences anyway.
It is.
I guess
yeah,
my question is
difficult.
obviously around, have we got lower funding or not? And you're saying, well, not really, because it's sort of, you know, it's over a period. Obviously, you understand that point about supply, the supply side of it. Okay.
You're right though, and it's maybe something that we could take away as a team, in that, you know, it's about, you know, the setting the target at the start of that 5 years and monitoring what we're delivering against that target. So, you know, if there is a reduction in funding, you know, or a reduction in budget or something slips, you know, we're able to track that a wee bit better. So we've got other tools that we do that in terms of the monitoring the programme itself, but I'll pick that up with the team to see if we could try and show that in this document as well.
And I'm really sorry to ask then, so delegated versus non-delegated, I'm sorry, I'm quite new.
So, I mean, Hannah, I don't know where you're read. Oh, so this is the bits that are delegated within the IJB, areas that are delegated under the IJB and areas that aren't. Yeah.
Does that help to answer your question? If anybody else from the Health and Social Care Partnership want to come in on that one?
That's fine, Shameen. That's okay.
Is that okay?
Just move on. We've got, yeah, that's fine.
Okay.
Thank you. Thanks, Wendy.
Okay. Councillor Jardine?
Sorry to come back in, but Jonathan's drawn my eye towards the funding elements, and I suppose I want to come back to the delegated element of it. Have we got a feel yet for what our projection might be for next year for adaptations in particular?
So I think in terms of council housing adaptations, yeah, so we've got our 5-year budget set for that. So it'll be there or thereabouts, Councillor Jardine, but the private sector investment, you know, that is still being worked through at the moment with finance colleagues based on the recent sort of allocation of funding to local authorities. So I don't think we'll know that until early next year.
Okay, and what you were talking about around a more localised understanding of need, that would potentially help identify where some of that funding also has to go, yeah?
Yes, absolutely.
Okay, thank you.
Okay. Do we have any other questions? No, I don't see any other. I just want to ask Hannah and Wendy, just not everybody will have been had time to look at the integrated impact assessment. I wonder if you could just comment on that. It's really important that we get as many people as voices and views pulled together in driving forward, you know, really important policy areas like this. I wonder if you could just comment on the work that you've done on the integrated impact assessment. And one of the things we've been talking about earlier about the whole system working together. So 3.15 about aids and adaptations play a critical role in supporting people and carers within their home. And there's mention there around demand outstripping available funding, and that resulting in delayed discharge, risk of injury, and impacting mental health through limited accessibility in and out of the home. Around, I just wondered if anybody from the Health and Social Care Partnership could comment on how much delayed discharges are impacted as a result of housing or aids or adaptations or unsuitable housing, if we have any information on that. Fiona Wilson?
Yeah, thanks, Chair. So yeah, housing does play an important part. We don't see, I suppose, given the presentation of our delays, it's not one of the main sources of delay, but where we do see challenges around kind of graded housing within mental health, as a particular challenge, particularly if people have had, and then also in areas where people have had really kind of traumatic episodes that mean they can't return to their own house. But our principles from the Health and Social Care Partnership and from the IJB is around home first and supporting people home, enabling them to do that. And often we're doing that either with care, or we're doing it with some adaptations to wait for further work to be done. So there's an important relationship there, but a lot of the work that we are also seeing is people who are already in their own homes who have degenerative conditions that need support to enable them to stay as well.
Okay, thank you. One other question I wanted to ask was around the importance of, you know, the critical link between housing and health around adaptable housing, but around mental health as well. So there was an example where, you know, at one stage there was no beds in the Royal Ed for East Lothian residents. So a project was set up to try and address that issue of Elder Street. And I wonder if some case studies could be put together around how housing has supported health in a way that you've provided that service locally to the local community, rather than that person then having to go to an external placement or be in hospital for longer than they need to be. And that was around the mental health in Elder Street and the learning disabilities team and the core and cluster. I know that's vitally important that housing provide up to 8 to 10 houses a year for the core and cluster, and that if that wasn't provided, where would those individuals be? David Hood.
Yeah, thanks for that, Chair. I think through the work that we're doing with Wendy, Hannah and the team, and I think the reference to the Housing Partners Board, I think that's one of the threads that we're really keen to pick up, and you know, making sure that people who don't need to be in hospital are not in hospital, and actually we've got alternative models for care, such as Elder Street, and there is obviously work ongoing around Elder Street and the environment and things like that, but using the appropriate community facilities that are there are really important. We're happy to bring back examples, because nobody should be going into a hospital that doesn't need to go into a hospital. But I think there is a gap there at times at the moment as that comes up. So happy to bring back examples if that will help.
Yeah, that'd be really helpful. I think it's just help us to better recognise the importance of housing, and I'm really pleased to see that health and Housing Partners Board has been established, and that we want to just make sure that all the right people are on that board and our ongoing engagement with that. Wendy?
Thanks, Shameen. And just one other thing to add, just you know, Hannah touched on it earlier in terms of, you know, appropriate and affordable housing for carers, and it's difficult to attract some carers into East Lothian as well, particularly in the rural areas. So again, just highlighting that that's another key piece of work that the team are looking at next year in terms of developing a key worker policy. So that may also help, you know, with some of the challenges that we're seeing in the recruitment sector.
That's welcome. That I'm glad. Good to hear about the key worker housing. Thank you. Hannah?
Just wanted to add on there that we'll also be working on, as a action through the LHS, the mental health needs assessment as well. So we can pick up some of that stuff that you mentioned in the needs assessment.
Oh, wow.
That's great. Thank you. Okay. Does anybody else want to come in? Nope. Okay, thank you. I would highly recommend reading the integrated impact assessment on this report. There was really thorough work, and I wanted to kind of pull that out to make sure that normally people that we say that are distant or not involved, the team made sure that they reached out far and wide to make sure it was a really thorough, robust, integrated impact assessment. So I'm grateful for that. I just want to check there's not any other questions on this, and just ask if anybody has any comments. No, I don't see any comments. I just want to thank Hannah and Wendy and all the other team, Fiona and David, for all the other work that's been going on with this housing contribution statement, but all behind that as well, all the other housing options that have been set up and developed to support people, and we see that on a daily basis: adaptable housing, accessible housing, and people with learning disabilities being able to live in their own communities with dignity and respect, supporting people with mental health issues, live in the local community, and homelessness. That if we get a safe, secure home for someone, and you know, Ms. McIntosh would have been wanted to contribute to the homelessness section, that there's less health interventions required if we get somebody out of homelessness and into a safe, secure home. So in the longer term, they're using the health service much less and living in a safe, secure home with dignity and respect. And there's also evidence of shorter life expectancy if you are suffering from homelessness. So all these are crucially important for us as a integrated joint board. So I'm really pleased that we're aligning the housing contribution statement and all the work that's gone on into that, but also mindful that there will be financial requirements for that to come through, and so really mindful that we get updated, that then we can manage that expectation, that we're aware that actually the resource is there to provide the 430 wheelchair access homes or not. So that'd be a really helpful thing to do as well, and we may wish to then change our directions as a result of the funding that you get, because one thing we don't want to do is raise expectations and have a direction that we're not able to meet. And I'm really mindful of the work that Housing, Tana and Wendy do to be able to make sure that we source that funding to be able to provide that adaptable and suitable homes for people, because it makes a significant difference to their health and well-being. Okay, thank you very much for that. We move on to the roll call, because this is one of the papers that requires one. So I'll pass that on to Fiona Curry.
Thank you, Chair. The recommendations are set out in section 2 of the report. Shameen Akhtar.
Agreed.
Jonathan Blaisby.
Agreed.
Patricia Cantley.
Agreed.
Andrew Cogan.
Agreed.
Jeremy Finlay.
Agreed.
Elizabeth Gordon.
Agreed.
Lynn Jordan.
Agree.
Carol McFarlane.
Agreed.
Thank you. That's the recommendations approved unanimously.
Thank you. Move on to agenda item number 5, which is change to the non-voting membership of the IJB, and that's Fiona Wilson.
I was going to cover this paper,
Curry, yeah.
Chair. Apologies for the confusion. I'll cover the paper.
That's okay. That's great. Thank you, Paul.
Thank you. This is a paper giving notification to the IJB of a change in membership. The background describes how in the middle of last year, the IJB approved the appointment of 2 applicants for the position of service user representative. Some months have passed since then, and one of the applicants, David Aston, has tendered his resignation. He was not with the IJB for a period of time before the resignation, so the IJB has had one service user representative probably since late 2023. The chair of the IJB has considered Mr. Aston's resignation and the need to have 2 service user representatives, and took a view that in view of the effectiveness of the existing service user representative member over the period that Mr. Aston was not in post, that we should revert back to the 1 service user representative post that we had previously. Members should note that the national legislation only requires 1 service user representative to be appointed by each IJB. So the paper asks the IJB to note Mr. Aston's resignation as service user representative, and is asked to support the intention not to seek a replacement for Mr. Aston, and as I said, to revert back to having 1 service user representative in line with legislation and guidance.
Thank you very much. Can I ask if there's any questions? Jonathan?
Yeah, thanks. Well, yes, so that's national guidance, the minimum representation. What is there a such thing as a best practice across the IJBs? Was it
across all of the Lothian IJBs, I understand our partner IJBs only have 1 service user representative. I'm not aware of what the situation is nationally.
Okay, thank you.
Okay, Councillor Jardine.
I just wondered, obviously not being involved for that long, how we ended up with 2 in the first place.
I think the feeling at the appointment, and Fiona can come in, Fiona Wilson can come in if she wishes. At the appointment, it was felt that we should test the use of 2 representatives to see whether we could extend the reach of representation. Mr. Aston wasn't in post long enough for that to be properly tested, but the existing person has done a sterling job as previously in maintaining representation across East Lothian and bringing views and concerns to the IJB. But I think Fiona's looking to come in.
Okay, Fiona Wilson.
Thank you. Absolutely spot on, Paul. And Siobhan, I think you were on the panel as well. We were interviewing when it was Peter Murray, and it was just, we were delighted that we had more than 1 applicant, and that there was people who were appointable to the role. So we felt that this was important to the kind of core of what we're trying to deliver as an IJB. So we were keen to appoint 2 people, given the position that we found ourselves in. It's not often that we do. So that was the premise of it. So,
okay, thank you.
Okay, thank you. Do you have any other questions or comments? No, I don't see any other questions or comments. We'll move on to the roll call. This requires a roll call vote.
Thank you, Chair. The recommendations are in section 2. Siobhan Akhtar.
Agreed.
Jonathan Blaisby.
Agreed.
Patricia Cantley.
Agreed.
Andrew Cogan.
Agreed.
Jeremy Finlay.
Agreed.
Elizabeth Gordon.
Agreed.
Lynn Jardine.
Agreed.
And Carol McFarlane.
Agreed.
Thank you. That's the recommendations approved unanimously.
Thank you. Move on to agenda item number 6, which is the confirmation of interim chief finance officer appointment, and that's Fiona Wilson.
Thank you, Chair. So the purpose of the report is just to inform the IJB of the interim appointment to the vacant chief financial officer position. The background you will be well aware of, just regarding the legality. The IJB is a public body, and as such it must have a responsible officer, a chief financial officer overseeing the financial governance of the board. We had the departure of Claire Flanagan, Chief Finance Officer, in September 2023, and interim arrangements were put in place with David King on a 3-day-a-week flexible basis between East and Mid. And the current arrangements for the East Lothian IJB CFO ended on the 6th of December with the departure of the post holder. We've had consultation with NHS Lothian and East Lothian Council, and Mr. Porteous was nominated to fill the CFO position on an interim and a whole-time equivalent basis, and this arrangement will continue until a substantive appointment is made. So the IJB is asked to, as part of the recommendations, note the appointment of Mike Porteous on an interim arrangement as East Lothian IJB Finance Officer until such a time as the permanent post holder is appointed. And I'll pause there. Thanks, Chair.
Thank you. Do I have any questions? I don't see any hands or any comments. So just this is a really important role for East Lothian IJB, so I'm pleased to see that we have somebody in post on an interim basis, so welcome to Mike Porteous. Okay, this paper requires a roll call, so I'll pass it on to Fiona Curry.
Chair, this paper is just for noting, so there's no roll call required.
Okay, thank you. We happy to agree?
Yeah.
Agreed. Thank you. Move on to agenda item number 7, which is the appointment to the Chief Finance Officer substantive post.
Thank you, Chair. And this paper really follows on and complements the previous paper. It's really to set out informing the IJB of the changes to the arrangements of the CFO post. Again, the legality is mentioned around the requirement for a CFO, and really the background that on establishment of the IJBs in 2015, it was agreed that one CFO post would be put in place to support both boards. With the departure of the previous Chief Finance Officer in 2023, interim arrangements were covered by a vacancy on 3 days a week, as I've just described in the previous item. The interim arrangements have continued while the permanent recruitment to the CFO post has been pursued, and unfortunately the recruitment rounds have been unsuccessful. I suppose the demands on the post holder have increased in recent months, and the focus on delivering by East Lothian, IJB and Mid Lothian on the financial recovery and delivering financial balance as kind of identified the resource available with this post. And it was following discussion with NHS Lothian, East Lothian Council, Mid Lothian Council. There's been an agreement reached that each IJB will appoint its own whole-time equivalent CFO, and that allows the CFO to focus on the financial challenges, and we hope be a more attractive proposition for the prospective candidates. The current 0.5 interim arrangements for East Lothian will end at the beginning of December with the departure of the interim CFO, and as we previously discussed, we've identified an interim arrangement. As part of the papers, there is the S bar just highlighting how we got to that decision, just in the process that we took just around the rounds of recruitment. But for the purposes of the IJB, the recommendations are that they note the discussion, the attached S bar, and the legal requirement to appoint a CFO, and note the current interim arrangements for the CFO post ending in the 6th of December. Note from the December 2024, and with the agreement of partners, it's intended to increase the hours of the CFO for the interim post from 0.5 to whole-time equivalent to increase that focus on securing a balanced budget. And then note the interim CFO appointment for East Lothian will be sought from either of the parent organisations, as we discussed before, as per the integration scheme. And I suppose finally agree that the substantive CFO post should be appointed on new terms on a whole-time equivalent basis. Thank you, Chair.
Okay, thank you. Can I ask if you have any questions on this paper? Councillor Jardine?
Yeah, just out of interest, I wonder who takes part in the recruitment process in terms of shortlisting and interviewing.
Yeah, so sorry, Chair, I'll just answer that. It will be the Chair, Vice Chair, the dotted line to the partner organisations, Director of Finance, and myself as Chief Officer.
Okay, thank you.
Okay, Patricia Cantley?
It was just to say thank you for the S-bar. I'm a great believer in papers that are 2 pages or less, and I thought that the S-bar format was nice and clear and simple for me as a clear and simple soul. So thank you for whoever put it together in S-bar format. I really like that, especially the R recommendation bit at the end. I do like a good S-bar, so whoever's idea that was, thank you.
I'll pass that on to our previous CFO, Claire Flanagan, who kindly pulled that together for us. So thank you.
Elizabeth Gordon.
Thanks. That's all very clear. Thanks for the paper. Just a quick question, just in terms of, like, obviously it's quite a tricky situation at the moment that we're in, financially, difficult times, and I just wondered what the sort of timeline is likely to be to move this to the to resolution, whether Mike is hopefully able to stay with us until that arrangement is in place, and what arrangements will be for a handover, because obviously David's already left. Is there going to be able to be any handover from David to Mike and then onto the permanent replacement? Thanks.
Thank you. So David has been doing a handover with Mike. Mike will speak today around to the financial paper. So that support has been put in place, as well as the 2 partner organisations. I know that Mike has met with Sarah and Ellie from East Lothian Council Finance, and he is obviously in conversation with NHS Lothian, being a previous NHS or being an NHS Lothian employee prior to this post. From a timescale, we have gone out to recruitment already, just around to run it alongside this approval, because we don't want to have a gap. And we're at the shortlisting stage because we recognise the urgency. And my understanding, unless Mr. Porteous has a different view, that he will stay on in the interim until we secure a substantive appointment. So I'm hoping I've answered all questions there.
Thanks, Fiona.
Jonathan?
Oh, sorry. Yeah, just a little bit more from one of Elizabeth's questions there. Just sorry. So what is the expected timing? What's your best sort of guess here in terms? Is it trying to get someone in post by 1st of April, or is it in 1st of June, July? I know but you say you've already obviously got some candidates, so that's like the first question. Second one was, has Midlothian sorted itself out in terms of its same issue? And thirdly, just on the whole full-time role, the paper sort of talks about it being, or part of the justification is to move from a part-time role to a full-time role because of the getting financial balance. But I guess a characterization of that is actually a short-term issue. So I think it's sort of more than just that, because to justify a full-time role in a permanent full-time role is presumably more than just getting balance for this year and going into next year.
Yeah.
Sorry, 3 questions there.
So the reason we've gone to full-time is just the demand on the role, and one of the huge conflicts for the CFO was the constant, and we felt it as the IJB, that often the CFO would start our meeting and then go to mids because they landed on a different day. So there is that increased demand. It is short term, but we also want them to be part of transformational work and lead on that as well. So I think we're more than just to the end of the year around the balance, if that's the question you're asking around kind of.
It was well, just the paper seems to justify going to full-time based on a short-term, a balance in the books in the short term. That's what it read to me. But what you're saying is that we have the justification for moving to full-time, a one whole-time role because there's a lot more to the role. So I guess my point is it's not just financial balance in the next 3 months or 6 months. It's much broader than that, and the role is going to be broader. Okay, because we've been asked to recommend to agree to a permanent full-time role, right? This isn't a short-term permanent.
Yes.
Okay. Sorry, that's the first one. Second one was around how are Midlothian getting on, and also just that question of timing to appoint a permanent. What's your best case in terms of getting that sorted out, and for Mike to return to his day job, no doubt.
So Midlothian are doing an internal arrangement initially, because they're they're working out their kind of longer term plan, and my understanding is they've appointed to the interim arrangement. I think these interviews took place this week, and then the final point was around timescales. So we're planning to interview the start of January. By the time we appoint, we could have up to 12 weeks notice for somebody. So it would be probably near the end of the financial year that we would be looking to appoint.
Okay, brilliant. Thank you very much, Mike, for helping out.
Do you have any other questions or comments? I don't see any other hands up. Okay, thank you for the paper. I think it's again previously that finance is a crucial role for us in getting that person in post, and also to support the managers in their role when they are looking at their budgets and financial challenges. So this paper requires a roll call, so I'll pass it over to you, Fiona Curry.
Thanks, Chair. The recommendations are as set out by Fiona Wilson. Shameen Akhtar.
Agreed.
Jonathan Blaisby.
Agreed.
Patricia Cantley.
Agreed.
Andrew Cogan.
Agreed.
Jeremy Finlay.
Agreed.
Elizabeth Gordon.
Agreed.
Lynn Jordan.
Agree.
And Carol McFarlane.
Agree.
Thank you. That's the recommendations approved unanimously. You're on mute, Chair.
And we'll move on to agenda item number 8, which is the planned improvement and scheduled care programme. That's Fiona Wilson.
Apologies me again, and also just the length of the paper, because I know the other two have been brief, but it is important. So this paper I'm bringing to you today really is to inform the IJB of plans by NHS Lothian to improve unscheduled care performance in partnership with the Lothian IJBs, the HSCPs and local authorities, with financial support from the Scottish Government. It seeks further agreement from the IJB to develop local and collaborative actions in supporting the unscheduled care performance. So the background to this is the unscheduled care framework. It's an integrated part of NHS Lothian's Lothian Strategic Development Framework, and it's overseen by a whole system programme board, which I chair as East Lothian Chief Officer, with support from a tactical committee, and both groups have senior wide representation from acute colleagues and the HSCPs. There's been a discussion since October with the Scottish Government around how could we support an approach to improve the performance of the 4-hour standard of the Royal Infirmary. And we looked collectively together around how we could do that with discussion with NHS Lothian, the Health and Social Care Partnerships and the local authorities. There was a clear urgency around doing this, and a kind of focus on improving the performance, but really with patient safety being at the centre. And we worked together to develop a comprehensive proposal that seeks really to address the deficits in demand and capacity really coming out of the health and social care system, all I know you are familiar with. The focus of the unscheduled care performance improvements are looking about the rollout of discharge without delay, looking at the experience for those in the emergency department, transforming the services and the rapid care assessment unit at the Royal Infirmary, importantly transferring models of care across for frail citizens, and then strengthening that flow navigation centre. And we've done a bit of demand and capacity work on that. As I take you through the paper, there's an expectation actually of what the proposed actions would be if we didn't get the proposal, and it's rather stark that around that impact. We also were really keen, as part of this discussion, of what we could do to recognise that the challenges that IJBs were facing around decisions, around having to make savings and efficiencies, and with a plan we put with one hand, were we taking away from somewhere else? So we have identified the gap within NHS Lothian, within the IJBs and the partners. The Short Life Working Group really has taken a leadership role from the Deputy Chief Exec of NHS Lothian, but also supported by other leaders like myself, and come up with a set of proposals, and we have included that in the report. But the proposals for performance improvement are really looking at 3 different components. And it's looking at the decompression of the system. And we've got them in the table around component 1, component 2, and component 3. And the objectives around the short life working group that we were agreeing on were reducing attendances, reducing bed occupancy, and reducing admissions, and reducing length of stay. As chief officers, we signed off the proposals as the bid went in, and we were very much seeing this as a really exciting prospect from an East Lothian perspective, because it allows us, with our proposal, to really support our strategic direction of home first. How do we galvanise the work that we've done around in-reach and our occupancy, but also not doing that at the risk of the community? So our proposals are focused on enhanced discharge to assess and social work and care at home. And this is really looking at pushing out a model at the front door and trying to shift that balance of where we will move to a single point of contact, but recognising people with unmet need in the community and people in hospital with who are waiting as delays. We plan to do this over 7 days. So our pathways really are augmenting our strategic direction, but they're also augmenting the work that has already been done and reputationally recognised within East Lothian, looking at the professional role and the multidisciplinary approach through social work and therapy, but also looking at the care aspect that's needed. And if you will recall that delayed discharges are big challenges around care at home when we look at delays. So there's a great opportunity around here for East Lothian. So from an IJB, there needs to be sign-off to note the Lothian-wide population and budgetary pressures faced by health and social care services and the effect these are on the current and projected performance of unscheduled care, and with the focus on the Royal Infirmary. Note that the work of the Short Life Working Group proposals and objectives to deliver performance and improvement across unscheduled care. Agree the specific actions and agreed costings for East Lothian outlined in pages 10, 11 and 12. And the attached documents on the unscheduled care system, the final proposal. And note that the Scottish Government has agreed to provide the funding to deliver the service transformations. And finally, agree to issue the direction at Section 7 to partners to support the delivery of improved unscheduled care performance. I think the other thing I just wanted to add, just on the back of the recommendations, is there has been a subsequent letter from the Cabinet Secretary that has come out just supporting the recurrency of the funding, because there was a nervousness around this, and that's gone to chairs, vice chairs, health board and local authority chief executive. I'll pause there, Chair.
Okay, thank you. Can I open it up for questions? Councillor Finlay.
Yes, thank you. Just my own clarity, under 3.19, it says additional social work staff will be employed to support the 7-day unscheduled care model. Is this moving staff around, or is this a new staff, and does the current budget support this?
Yeah, so this is new staff. We put in a bid for additional. So this funding has to bring additionality. It's not about funding gaps. It's about bringing additionality that will assist with performance. So this is about new staff.
And the funding completely covers that?
Completely covers it, yeah.
Okay, thank you.
Okay, thank you. And Elizabeth, and then Lynn, and then Andrew.
Thanks. Thanks for that report, Fiona. And obviously, seems like very much a good news situation here. So that's great to see. I had 2 questions. The first one was, I think it says in 8.6 it will involve an extra 53 whole-time equivalent staff, and I just wondered how are you anticipating that being difficult to find the right people to fill those roles? So that was the first question. And my second question was, is this work at risk of being undermined by the story in the following paper that we've got by posing all these, talking about the clinical risks and so on of, like, for example, cutting physiotherapy and occupational health and so on, and how these two are going to work together so that we do get the improvement that we need? Thanks.
Yeah, so workforce, it is a challenge, and one of the reasons that we have taken it through hospital to home, which is our care at home arm that sits under health, is just around the attractiveness of being able to recruit, rather than we know it's a challenge within commission services. We also have the opportunity of on the back of decisions that we took in March around, we have a number of staff on redeployment, so it allows us to potentially match people who are sitting on redeployment to keep them local, that would pick up opportunities for people. That's not to say that we will have to go out to additional workforce. Our other IJBs, HSCPs are not doing a similar model, so it's not that we're all fishing from the same pools. Edinburgh are using commission services, and Mid are doing something differently around commission services. So well, I think it would be wrong to say that workforce wasn't a risk. I think we have opportunities around staff sitting on redeployment, and also this is something really exciting around shifting that balance and doing something different around assessment that may be seen as an attractive alternative to people, and East have got a reputation. Your other, sorry, just remind me of your other question. It was just there in my head, and
it was just whether or not this good work could end up being at risk of being undermined by the other problems that we've got in the pressures. Thanks.
Yeah, so we thought carefully around this, and actually we don't believe it will, because our challenge is around care at home, and we've already highlighted the risks around care at home and taking any more out that budget. What I think it will allow, though, is a real opportunity of pump priming some work to look at us looking at transformation. And again, and I think it was mentioned earlier, maybe by the chair, around that kind of bed-based model versus a home. And I think this offers a great opportunity to really test that. That's something that the work of InReach and the work that the ICAT team have already been pushing, along with our colleagues in social work. So remember, when we're looking at some of the grip and control, we've got the daily huddle, we've got the care at home huddle. So allows us to just stretch that emphasis around, I suppose, shifting that approach of what we can do in East Lothian. And care has always been a barrier, and where the assessment takes place. So that's what we see as the opportunity. So I hope that's answered your question.
Thanks, Fiona. That's great. Thanks.
Okay, is that okay? Councillor Jardine, and then Andrew.
Thank you, Chair. Fiona, I think you'll appreciate I've probably got a number of questions. I kind of want to start with at 3.15. Now, I've possibly read this wrong, but the last statement there says, as the funding was only approved at this date, the delivery of component 1 by the 31st of December will be challenging. I've kind of interpreted that, and I'm probably wrong, that's in-year funding. Is that right?
No, so the delivery is because we put the bid in, and when we got the response to the bid, it was probably about 3 or 4 weeks when we put, so it pushes back the timescales. The funding is not the challenge, it's recurrent. It's just the timescales for delivery, Councillor Jardine, that's pushed back. So we anticipated we'd be able to start, if we heard three weeks earlier, we would have started the recruitment with some of the work. We can't do that because we've heard 3 weeks later, and then we're knocking on. So that's the delivery of the challenge with the timescales.
So there is in-year funding that is recurrent.
So there's funding, yes. So the funding is recurrent. Okay. What they're giving us is not the full year, because we've only got to the end of the financial year, so it's split, and then going forward, and then I think and I was keen to emphasise, the concern was that's okay if it's we get the funding, but it has to be on a recurrent basis, because how do we recruit? How do we attract people? So that was the background.
Just on the attracting people and following up on Elizabeth's questions, I suppose I'm mindful that this is resources that will cover clinical and non-clinical staff. And in terms of the non-clinical, I'm aware that we've got probably more challenging workforce issues And I wonder to what extent we might be robbing Peter to pay Paul by recruiting into health on better terms and conditions from third sector or local authority. But, you know, I just wondered if you thought any thoughts on that.
Yeah, and Gillian's put her hand up, so I'll ask her to come in on this. So yeah, really thoughtful about that, and that's a kind of ongoing challenge. But we felt that this was the best opportunity to do it, given we'd gone out to recruitment probably about this time last year, Gillian, and had a fair amount of interest, and then budgets challenged what we were able to do. But I don't know, Gillian, if you want to come in on that.
I think, again, I think it's a very valid point, and we've thought about it very carefully. But again, I just think going back to Fiona's point about the number of staff that we have on redeployment, our advert went live only a couple of days ago, and we've had a tremendous amount of interest so far. And again, a lot of staff who have the skill set that are really interested in working within the sort of community setting. So again, a really good opportunity for those that are on redeployment to get permanent positions, doing something that is very creative, and again, supporting that sort of hospital and community work. So it's looking positive so far.
Okay, and I'm going to try and batch my next bits together. So that first table that's presented, table 1, the impact that's proposed, does seem to be a fairly rapid turnaround in performance, which, as someone who's worked in sort of innovation previously, it makes me curious as whether something like this has been tried before. And I know that we have been working for so many years at trying to change that balance of care. And I'm not sure to what extent, because this is a royal infirmary issue now, whether there's a need to focus more on the clinical, and I'm going to say the wrong thing, values, governance, as opposed to, because we do already do a fantastic job of the in-reach and the community work that we do. So I'm just wondering how, you know, what's changing in the clinical sphere that enables some of this sort of care pathways thinking to change.
So I guess a couple of points on that. What's changing is the work that InReach and ICAT are doing to influence their colleagues of a different approach. And what I would say is the real change, having been in other IJBs and been around this for a while, is the leadership and push on this. And I say this in the context that the Short Life Working Group was a really powerful group around sharing ideas and direction around what is going to give us the optimum impact and that kind of culture. And one of the things I would say is a change is colleagues in NHS Lothian, kind of my peers and the executive management recognising, and it was a point, beds are not the answer. And that is shifting and influencing, and that leadership to direct. Now we've still got a long way to go, and some of that shift will be proof that we can deliver what this ambitious plan says. There is a real ambition around how many beds, and we recognised from an East perspective there would be a little bit of a lag for us by the time we recruit, and that's where the reliance on Edinburgh, who are using commission services, to be that kind of first tranche of being able to deliver. I suppose the other thing to say is this is a system-wide, so much as we want East to be successful, it's in our interest as a Lothian system that we're all successful, to the benefit of the impact on the Royal Infirmary. And you'll have heard me talk about our occupancy at times being quite low for East, but still are people who are waiting on trolleys or waiting on waiting lists for surgery. And so this is why it's important that we collectively do it, but recognising our approach for our areas will be different. I think there's more work to do, Councillor Jarjan, and we have to keep at it, but there is a shift. The other thing to add, we've had really good support from the Scottish Government around wanting to do something different as part of the kind of reform agenda, and civil servants recognising beds aren't the answer either. So that has helped around some of the push, and they're ambitious for this to be successful as well. So I think there is more work on clinical pathways. That's where I think our next phase as we bring it is actually how do we get to a single point of contact where the GP, how we can wrap around that kind of primary care support rather than the only option being going to ED. But the components we're putting in allows us to have a little bit of power and muscle around that direction, which we've already seen from the work we've done in Reach.
Okay, thanks.
Okay, is that all your questions, Councillor Jardine? Okay, I'll move on to Andrew and then Jonathan and then Patricia. And then
Thanks,
Isabel.
Fiona. I won't repeat similar issues and concerns that both Elizabeth and Lynn has gone through. I just want to try and help myself in terms of the context here. The unscheduled care challenge is about as great as it's ever been, isn't it? You know, today that we have significant numbers of people from all 4 local authorities really suffering as a result of the pressures in the unscheduled care system. So one, I think we should all welcome the Scottish Government's response to this, to say that they are willing to commit significant millions of pounds worth of additional monies to try and help that situation. So I think we all recognise that's very positive. The easiest thing to have done would have been, let's have more beds at the infirmary. And I think you should, and team should be applauded for resisting that, which is the easiest and the simplest, but the one proven to probably be the least effective. So congratulations and well done to the teams. But with this, not new model, because we all know this is the right thing to do, but this is where the real test comes, and we're testing something. I think Lynn's point there, we're testing something in the most challenging situation and when the system is the most unstable. However, it's the right thing to do. So my general points are very positive. The question is your level of confidence that with all of those challenges, we will see the numbers that Scottish Government are looking to see actually change, because my slight concern is we could be blown away by a wave of COVID or a wave of flu, that we do all the right things and yet that performance number doesn't change. And how are you going to compensate and mitigate some of those challenges if some of the numbers don't change, in the knowledge that this is fundamentally the right thing to do?
Yes, so I think my confidence around the plan is fairly high. I suppose the one risk, and Elizabeth picked up, is around the workforce element. I think we're in a good place from an East Lothian perspective around what we do already around enhancing on that. I suppose and it's back to my point, we need all of the IJBs, HSCPs, the whole plan to be successful to see the importance. I suppose there's confidence in East Lothian with what we do, and we can enhance that further. So it will allow us to pull more people quickly to the community hospital. Importantly, it'll allow us to get people home the first time, the right time, and it'll allow the InReach team to have some care, social workers to have some care, to enable them to hold people or return them home. And I think that then starts pushing the Lynn, Councillor Jardine question around the clinical model of, actually, these people aren't there for clinicians because we're taking them, and we've got different pathways, hospital at home, care home team, different pathways that support. So while we're confident in the plan, we are reliant on the others to make this plan successful, and it's in our interest to support them as well as a system. So it is very much targeted at the Royal Infirmary. What we see at times of pressure is often our East Lothian people go to the Western. So how do we make sure that that people aren't losing out? And that's why we've put in this increase in care that supports already people at risk in the community, but also in other sites that will help that Lothian system. Hope that answers it.
Okay, and Isabel, did you want to come in on this?
Yeah, it was just to go back to Councillor Jardine's point, really, which was around robbing Peter to pay Paul? Are we not doing that? So one of the things we do is we keep figures. We have regular weekly figures on how many hours our external providers are providing of care, how many our internal are, and this would be another, how many people we've got on direct payments that are getting home care. So we have figures around that weekly that are presented, so we can keep an eye on it through that structure, just to look at whether it's making a difference in terms of that pool. And the other point, so we can monitor that, and we do at the moment. The other thing I was just going to say is in terms of the social work perspective. So we have quite often placements break down at last minute, and usually because of carer stress or something's happened with the carer, and we can't find home care for people. That what this model will do is provide that flexibility that we'll have it at the front, and they end up going into A&E or hospital. The person's admitted as a social admission, and what this model will do is that will help that, because there will be some flexibility at the front end to be able to deliver that, to prevent that person going into hospital. So, and we've already seen it with a couple of cases that we've been trialing, that we're picking up. So for me, that works really well. And I also think it'll free up, well, we'll see, but we're hoping that it'll free it up as part of the whole process. If we're stopping that bit at the front, it'll also stop the back end of home care as well. So that's what the plan is too.
Okay,
It'll
thanks
free
very
up
much.
some capacity there.
That's great, thank you. And Leslie, did you want to come in on this point as well?
So I just wanted to say we did actually, this is, I think, to Councillor Jardine's point, we have trialled this enhanced discharge to assess. We did trial it pre-COVID and it was really successful. It was how we support people out of hospital sooner, give them reablement, and how they need less care in the after that intervention. Also, people who have got fractured shoulders and things do not need to be in hospital. They just need a bit of help to go home as soon as possible, and where there's less risk. And I also think we've learned hugely from InReach on data. And I think that we are a data-driven service, and therefore, where a lot of areas might not be confident on their data, I am very confident on the data we already gather and how we can inform our processes. So on two sides, once we have tried it before and we actually are already doing it, and secondly, this will help us to sort of make it main core business, but also we are sure that the data will support it.
Okay, thank you, Leslie. Jonathan, and then Patricia.
Yeah, I mean, the comments that Andrew made, Fiona, you've made in terms of this, you cannot underestimate the importance of this initiative, really can't, through the whole system. My question and concern is really around execution of this plan and how that is going to be done. If we read the letter from the Scottish Government, which you've attached in the paper, they make it very clear that the funding is dependent on meeting these improvements and beyond March 25. Now, in the pack, we see incredible transformation in the modelling here. The 4-hour wait going from 50% to 85% by March. The 8-hour long wait disappearing. Not just being eliminated by March. And I'm extremely concerned about. Fiona, I guess my question is, how have we got confidence in this modelling that we are going to 85% for a system that has never achieved anything beyond 50 almost? Well, certainly the Royal hasn't forever, and across Scotland the average is 65%. So we know, and so I'm really kind of really concerned about the execution, the governance, the project management. How are we going to make sure this is a success for all of us, so the Scottish Government cannot turn around in 3 months' time and say, the funding, we're not going to continue this because you've clearly failed in what you said you would do. So I don't want to be to be so negative, because I think this is incredibly important, but I would like some understanding of how we've got to this point in terms of that modelling, the confidence you have in that modelling in terms of this plan.
Yeah, so thank you. So one thing to say, the reason we pushed and I pushed to bring it to the IJBs is I didn't want it to be a health board. I wanted the IJBs to have direction and oversight and monitoring the performance. So that is really, really important around that approach, around the kind of assurance and confidence. We've modelled it through the short life working group based on data, and we've also, each of the IJBs and the acute team have put in the kind of the proposed timescales of when they think they're going to hit target that allows us to get up to the 85. There's no doubt there's a much as there's data, there is a leap of faith because culture comes into this and leadership comes into this as well. So we are reliant on Edinburgh going first around some of the commission services. We've identified from an East perspective the level of detail of, okay, if we've got a tranche of staff to start with, where are we going to target first? And we're going to target the front door end to try and change that direction. And then similarly, we've worked the timescales as well as where we're targeting next, and that's within the plan. And there's a twice weekly meeting that we're meeting using the data within NHS Lothian and leaders like myself, looking at the data and monitoring against the trajectory and the project plan. So the modelling has been done with the 3 IJBs because West are not involved since it's targeting the Royal Infirmary. They chose not to be, as well as the information we already had. It is ambitious. It relies more just on capacity. It does rely on leadership. It relies on everybody saying the thing, challenges, and that will be the real test. Now we've got the plan together. We have to deliver it. So so that's how the modelling has been. So it's not just on access, it is around that direction as well. And some of that, a big chunk of that, relies internally already in acute and improving the work that they are doing. So all of that combination comes into it, and there's tight scheduled monitoring on that.
Okay.
Okay, Jonathan. Okay, thanks, Jonathan. Patricia?
Thank you. Again, I'd like to echo a lot of the comments already made. The thing I'd like to know more about, though, is how are we going to communicate this? Because this is, by and large, a good news story. But I think the comms around it are very important because there's still a huge culture out there of, oh, well, we'd better go to the hospital to get checked out. And actually, somehow we need to shift the dial, not just at the IJB, not just with NHS Lothian, but with the wider public at large. Now, you do meet quite a lot of people who are desperate to avoid hospitals, many of whom have had previous experience there. But I think there is something about how do we shift the dial, shift public expectation. And I mean, getting a good news story into the press, local or national, is like getting Christmas camels through the eyes of proverbial needles. But what are we doing in terms of comms is what my question boils down to. How are we selling this to the people? It should be an easy sell, but actually, I think it's not as easy a sell as we think it might be. So I'd like to know how we're doing with the comms on this, and can we get some good news stories into the local press, please?
Yeah, absolutely. So comms wise, we have got a communications plan as part of the project board that we Lothian system wide, and we will be doing similar in East Lothian. The other thing that we are really keen to do, though, is as part of that comms is how we attract staff. How do we attract AHPs, social workers, to something really exciting? And that as well then will help some of the information and how we work with our local community. We've done quite a lot already on Home First, but comms and Jen Jarvis, who will be on this call, I'm sure will be part of that. So we'll have something centrally and then something locally as well around I suppose just this what we know, your own bed's the best bed. We're trying to change what we do or enhance actually what we're doing already, and lots of opportunities for that. But there's 2 comms plans, one we'll have and we'll have one centrally as well. I think what I suppose people on the group, we were keen to just make sure the governance that of going through the IJBs took place first before we did anything further, because that's important to give IJBs their place. And I have to say, for those of us who've been around this for some time, this is really, really positive that it's pushing the IJBs to have oversight and the use of the directions around the monitoring. And again, it gets into our discussions around where we want to go, what we're ambitious for. I know some of this is around kind of change, but actually we want to get into the unscheduled care beds for East Lothian. We want to get into changing who does assessment and where it happens. This enables this to happen. But we're balancing the enthusiasm with the reality, because while we believe in ourselves in East Lothian, we need others to, and we also want the system to be in the same place we are in East. So I'll pause there.
Okay, is there any other questions? I don't see any hands up. Fiona, I just wanted to ask around 3.20, which is additional 350 hours of care at home, and also around community OTs and people out in the local community that support individuals that are coming out of hospital and be able to stay at home as long as possible and then not having to go back into. So those, we've talked a little bit about unintended consequences. So that additional money won't help us plug our own gap of 300 hours that we require for daily discharges. This is additional 300 hours to plug another gap, is what we're saying today.
No, so this money is targeted at the unmet need in the community, the unmet need associated with delayed discharge, and also putting in support at that front end. It is about additionality because we don't have it, because we can't afford to meet that, and it just has to go through process. It won't plug the gap that we've got within the IJB budget that we've got existing, but this is about creating additionality. So it will support those people waiting around unmet need in the community, because what we don't want to do is these people are just as important. They're all East Lothian people. So we have put in a bid that it covers all of that, but it does come with additionality. It's not about plugging the gap we already have around financially.
So it doesn't help us to support and the next paper shows us the levels of OTs and community OTs and the reduction and the levels of vacancies in there. Does that help us to support the OTs and the community OTs?
No, because it's targeting the Royal Infirmary unscheduled care. So it is looking at OTs, but it's additional capacity. The current OT vacancies in Leslieberry will come in on this around the community OTs is targeting a different purpose. So it's not about filling the financial gap, it's about additionality. Do you want to come in on that, Leslie, maybe?
Yes, so what we are aware of is we are using a completely transformational model at the front, how we, instead of checking up on care at the back end when somebody's already been given it for 6 months to a year, we're going to assess the people in their own homes and supply them with rehabilitation and the appropriate amount of care that's required. Now, you're absolutely right that there may be knock-on effects to adaptations and long-term, but we don't know that yet. So what we will be doing is carefully monitoring it. But the transformation is at the front door. The transformation is that entry back into the community and also supporting people with additionality for rehabilitation and for care. But we will be, and I can assure you, we will be closely monitoring any effects onto the community OT services and adaptations and equipment.
Okay, thank you. I can see, Isabel, you had your hand up.
Yeah, I just wanted to say that if we're providing it at the front door, my thinking on this is if we're providing it at the front door, it'll free up further down the line, because these people will not be coming through requesting home care, because we'll be giving them it at the front door and trying to retain them at home, you know. So my hope is that this will then free it up as we kind of go through the process. They won't be looking for it later on, and we'll be giving it to them as quickly as we possibly can, rather than them sitting in hospital or wherever, or in the community deteriorating. And so that's my thoughts on it.
Okay, thank you, Isabel. And Fiona Wilson?
Yeah, I was just going to come back on that, because Isabel and Leslie are spot on. This is where the opportunity around the transformation, because if we can do this work, it may release efficiencies in a different way or allow us to do things differently, which creates opportunities for us. So I again, just emphasising, if we get to people quick enough, and the work that Isabel, Leslie and Gillian have led just around the care at home huddle has shown the art of the possible through a multidisciplinary approach. We're strengthening this further, that will create efficiencies, I have no doubt, in other places.
Okay, and if you've helped the system to create efficiencies, will that come back to, for example, East Lothian?
Yeah, because it sits with well, whatever it impacts on East Lothian should come back to the IJB. So yeah.
Okay, that's grand. I want to check if there's any other questions or any comments. I don't see any hands up. I think it's been we've got a number of really important papers, and I think I'm mindful of the next paper, and also mindful that there's no administrative or management support costs factored in here, which mentions on page 68. So I think it's really important that we monitor this really carefully. Also, Leslie, you've mentioned that we really monitor the unintended consequences and the knock-on effects for other parts of the system, because you're the ones on the front line and your staff that are working on there. So we don't want to be in a system where we're robbing Peter to pay Paul and the system is going the other way. So I think that's really important that we're really keeping an eye on the unintended consequences on the impact of care at home, both externally and internally as well, and also mindful of the pressures on staff, which the next paper that we go on to talks about that in a lot of detail. Okay, I don't think there's anything else that you want to say on that one.
Well, okay.
We'll move on to there's a roll call for this paper. I think we're agreeing on the premise that we do monitor the unintended consequences on staffing on the system, and that's reported back to the IJB if we're taking this forward as a direction. Okay. I'll pass it on to you, Fiona Curry.
Thank you, Chair. The recommendations are set out in section 2 of the report. Shmeen Akhtar.
Agreed.
Jonathan Blaisby.
Agreed.
Tisha Cantley.
Agreed.
Andrew Cogan.
Agreed.
Jeremy Finlay.
Agreed.
Elizabeth Gordon.
Agreed.
Lynn Jardine.
Agreed.
Carol McFarlane.
Agreed.
Thank you. That's the recommendations approved unanimously.
Thank you. Move on to agenda item number 9, which is risk for clinical and social work services arising from current and planned budgetary efficiencies, and that's Leslie Berry.
Yeah, thank you, Chair. So today I'm going to bring a paper talking about the risk for clinical and social work services arising from the current and planned budget recovery actions. So the purpose of this paper is to present to the Integrated Joint Board the risk of adhering to the professional standards associated with the current and planned programmes of fiscal recovery actions, associated efficiencies and service reductions across East Lothian Health and Social Care Partnership, as assessed by my colleagues, the professional leads for social work, myself and nursing and the clinical director. We have all jointly worked together on this paper for some time now. So I'd just like, the background of this paper is that all of us as professional leads have been coming to our many meetings with the IJB, both in development sessions and more formal sessions, and have expressed our concerns about the effects of the budgetary constraints that are being put on us. We have gathered together the evidence on each different individuals and how it affects their individual services, and all are here today so we can answer your questions. To that end, we have got recommendations, and the first one is the IJB is asked to note the professional standards required to be upheld by the health and social care workforce which are at risk, to agree the risks described demonstrated that financial savings to date have increased the stress on the already vulnerable services, and with the continued increase in demand on services together with the financial constraints may limit further efficiencies within the service delivered and may not be achieved. We are asking to agree the continued efforts will be made to ensure the efficiency in service delivery, but that any further pressures on health and social care budget in order to deliver a balanced budget may reduce the ability to achieve a positive health and well-being outcomes for East Lothian residents. And finally, we'd like to formally escalate these concerns to the IJB partners as part of the wider discussions on financial recovery plans with the funding partners. If you have any questions for our professional leads, I think we're all on screen today.
Okay, thank you, Leslie. Can I just open that up for questions? I don't see any hands up. Councillor Jardine?
I think the fact that all of us have kind of gone nothing to ask is maybe a bit of a sign that we have digested everything that is in the report. And I know certainly from my own experience as well, none of what is presented there is necessarily a surprise to me. It's a really hard read. And I just wanted to commend the officers for having taken the time to actually make sure that this important paper is here. I think I don't have any questions in particular, but I can't disagree with anything that's written there.
Okay, thank you. I just wanted to ask the question. I agree with the comments made by yourself, Councillor Jardine, but around it's a challenge for everybody in the system, and part of that we have to make sure that we're escalating. So I absolutely agree of escalating it to the partners, but this may be something that we also include our letter to the Cabinet Secretary to really outline the challenges that staff are facing. And it's really important that we say, we acknowledge to staff that we're listening to what you're saying. We recognise, understand the challenges that you're facing, and it's our responsibility to make sure we're raising these at the most appropriate levels. It was around page 11, 103 of our papers, internal care at home services. So within the system, you've got social care, social workers and health, and how we're making sure that we're also fully cognizant of the challenges that social care staff are facing.
If Isabel wants to answer that, or Gillian?
Yep. Probably Gillian. I mean, Gillian's got a part on the internal bit, and it's in the paper, internal home care and the challenges she's facing. So there's actually a part in the paper that talks to that.
Okay.
And she talks about the sickness levels and.
Okay, thank you. Laura?
Yeah, I suppose it was just a reassurance. I suppose our social care staff, so our frontline services, the home care staff, if you like, delivering that care are very much part of our workforce, sit alongside all the sort of well-being and strategies we put to support people into the workforce. They are where we see the highest level of absence. We have had an improvement in the retention of staff in that area due to a number of measures that Gillian's teams have put in place to support the care staff that are out walking the streets. And we'll all remember the challenges and the continued challenges, particularly as we go into winter, that they face. And I suppose it's just a reassurance that yes, they're certainly within this paper, and that's why we added that part with regards to our internal care home, recognising the particular pressure that they're under and therefore the additional support that they are offered.
Okay, and can I ask if there's any work being done by the professional bodies themselves about the challenges that staff are facing? I've got Laura and then Isabel and then Leslie.
Sorry, my hand
Isabel.
was up previously.
Isabel.
Sorry, Isabel.
So I know that the Chief Social Work Officers event last week, and I know that they were highlighting it there and some of the concerns around it, and it's been discussed kind of nationally. I didn't stay to find out what the plan was to do about it, but I can find that out. But I know across the country the same issues are being raised in terms of social work.
Okay, thank you. I've got Leslie and then Sarah.
So just to answer your question, absolutely, it's been raised on the Royal College of OT, but more recently on the Chartered Society of Physiotherapy. One of my members' staff actually is the chair of the Chartered Society of Physiotherapy for Scotland, and she has been at the Scottish Government and in working with the gentleman who represents that service. And what we're saying is we are worried about the risk to rehabilitation and the right to rehabilitation. And I think that the Chartered Society and the Royal College of OT are very much going to the government to say it's not only a right to live in your own home, but it's a right to rehabilitation so that you can live your best life. And that has been taken to the Scottish Government as we speak, I think.
Okay, thank you. Sarah and then Jonathan.
Thank you. Yeah, just to reiterate what my colleagues have said, it's certainly through the nursing professional bodies there is a lot of recognition and sort of monitoring and reviewing nationally of the situation. But I think for me, what is key is their offer of support for staff, which I think is really important. So making sure there's that real focus on well-being and having a look at how they can, support with that well-being as well.
Okay, thank you. Jonathan?
Yeah, thanks for this report. As Lynn said, it's very well laid out and very, very comprehensive and a bit depressing. I mean, all individuals can do who work in health and social care is do the right thing themselves, isn't it? Individually, you can't change the system. You've got to work as best you can. But I would say that it's really, really important that within the disciplines, there's a culture where individuals and staff feel that they can speak up if there is any threat, or they believe there is a threat to breaching professional standards. And be confident and safe and feel safe in raising those concerns. I'm not sure if I have a question. It's more of a comment that just came to me when you're all talking there. So that was it, Shameen.
Okay, thank you. Sarah, did you want to come in on that one?
Yes, thank you. I was asked to comment the other day on what's gone well or what difference I've seen over the last year, and the reply I gave was that I felt people were using their professional voice a lot differently this year. I'll speak on behalf of nurses, but I believe that we always give people the opportunity to speak up, and I hope that they feel confident to do that. But I feel that people are using their professional voice, as I said, a lot more this year just to speak about their concerns. So I have seen a difference.
Okay, thank you, Sarah. John?
Yeah, thank you, Chair, and thanks to you and Lynn and Jonathan for your comments as well. I'm expecting lots of questions on this paper, and there have been less than we expected, but I hope that reflects the situation and how it was written. Not surprisingly, I would reiterate what Sarah and Leslie have said, that the medical professional organisations, the Royal College of Physicians, Royal College of GPs and the BMA are all being we as an HSCP to try and make sure that they know when to escalate problems and when there is a risk of patient safety issues, that we escalate those appropriately and make sure that they're not carrying that risk as individuals, and we consider that risk as an organisation and make sure it's well known, and encouraging them to speak up as much as possible. I guess the other thing I would say is, although there's a lot of negatives in the paper, I've been reflecting over the last few days. We had a senior leaders event on Friday for all of NHS Lothian, and one of the things we were asked to do was to reflect on successes over the past year, which I think everyone found quite challenging. But I think hopefully not surprisingly, one of the things that came out of that was a lot of people saying that although there have been lots of real difficulties over the past year and challenges in the way that we've had to communicate as professionals, what it has shown is an awful lot of real professionalism and kindness towards each other and understanding in recognising the difficult situations that we've found ourselves in. Inevitably, there are some circumstances when people become upset or find situations difficult and don't necessarily always respond in the way that they would like to, but the great majority of conversations are really respectful and focusing on being sustainable for colleagues and getting the best outcome for patients at the end of the day, and that is quite remarkable in some ways, given some of the difficult situations we've found ourselves. I'd want to put on the record at this meeting as well, my thanks to all of our professional colleagues across the whole system for how well they've approached that over the last year or two, which I think has been commendable. Thanks.
Thank you, John. Isabel?
Yeah, I just wanted to say that, Jonathan, to pick up on your point and obviously to reiterate what Sarah was saying, there's a requirement as part of our code, social work code of conduct and code of practice, there's a requirement to speak up for individuals if they feel that that there are things within operations that are impacting them on their ability to do their job. So there's actually a requirement to speak up. And as part of our workforce group, our codes of practice are on that agenda, and we're discussing that, you know, on a regular basis. And what I would say to you is that this is the first time ever, and I've been in social work a long time, that I've heard people being as vocal about anything like this. You've always had your one or two, but it was, you know, it took up one of our whole meetings just talking about this. And one of the things we've been asked to do is to think about data, but this is about qualitative feedback from people saying this is a struggle to work in, and it's not just about how many people, it's about the way that they're practicing. You know, they're having to take, you know, our structures have changed as a result of the financial challenges. So previously, you know, senior practitioners would have signed off any packages of care. Now they're all being scrutinised heavily by and coming in centrally to a resource panel, and quite a number of them are going back and being asked for further and scrutinised further. So it's the way of working that's changing as well, and because of the financial climate we're in, not just figures coming down, you know, data being affected, and that's the qualitative feedback certainly I'm getting through social work staff.
Thank you. Do you have any other?
Yeah, I think, Shameen, I'd say, just to add on, I think that culture is incredibly important. I mean, I get it that there are professional requirements, but I think, you know, yeah, that culture, driving a culture where staff feel safe, and I mean right across the whole, right across the board, so staff feel safe to speak up, I think is challenging in this kind of environment, because staff in certain areas can feel kind of a bit under threat. They might even feel their job is under threat, and those individuals may not want to speak up at those times. They almost don't want their head, to stick their head up. So I think having that culture where we really encourage staff to speak up when they're in these difficult situations is just so it's more important now than ever, I'd say. And I think, John, you've said the same as well there. So I just just agree with you wholeheartedly.
Thank you, Jonathan. Kalonji?
Yeah, just really to echo that. And I think sometimes we take it for granted because we assume that people will feel like that. And sometimes it's very important just to reiterate that, so people feel that actually I can speak up. Because I think many of us have been in meetings where once someone says something and then other people are like, oh, actually I've got a view on this as well. So it's just really just encouraging that.
Thank you, Kalonji. Isabel?
Sorry, just one last comment. That people that the social workers and its team managers that come to the workforce group have valued the fact that their comments have been taken through this paper. They've been listened to, they've been heard, and they're going to the IJB through this paper, and that they've also been seen by the Chief Social Work Officer. So there's a value in this paper for people out there as well, and it feels like it's been heard.
That's great. I appreciate that, Isabel. Thank you for that feedback. I just want to give the professionals any other opportunities if they want to say anything else. And when I first read this, my first instinct was around the health and well-being of the staff. You've shown how much in crisis, that you can't say it in any other way, that our staff are feeling in some areas, and along that, as an IJB, how we are reassured that we're doing everything we can to support the health and well-being of the workforce right across the board, social care, social work, health, while they are in this really difficult, challenging environments, and how we find different ways of supporting that. And I can see that's brought lots of teams together to try, to support each other through really difficult, challenging times, and made you think about delivering services differently. But I know we talked a lot about data, but we're talking about people. So you're, looking after lots of other people. How do we make sure that we're looking after our workforce? And I don't know if you want to make any comment around about supporting the health and well-being of staff during, looking at this really difficult and tough challenge on paper. Is Leslie?
So I think we should acknowledge the staff themselves have recognised that they are under pressure. And so, like our professions, like many other areas, have been having their own wellbeing groups that are very, very active. And they have social events after work. They have fundraisers. They have lots of different things. They have get-togethers, training. They have professional meetings that they can air their problems with. We have lots of other supports. And I know that there's just been a list sent out today to all people, that all the counselling that's available and everything else. But I think as managers, you're right. What we have to do is be listening to the staff. And so we have interactions with all our staff, every single member, where we have open forums where all our staff get opportunities to ask questions. And we talk about things like what are going to the IJB, what is our financial position. And I think sometimes being open and transparent with staff, they feel respected, that they are aware of what is going on. And I think that is hugely important in my professional opinion. I think they are recognised. But I also like to say one last thing. The amount of multi-professional work that's happened in the last year or so has been amazing. And we've all been under pressure. But it's amazing how you can get so many different professions to support each other and to start to see each other's pressures as well and recognise their pressures in other areas. So instead of competing, I think really I've seen more working together as to a common goal in the last year or so than I've ever seen in my very long career. So I would just like to thank my colleagues for that.
Okay, thank you, Leslie. I've got Isabel and then John.
Yeah, one of the things that we went, I think that's right, Leslie. I would agree with you, first of all. And just one of the things that we've just done recently, so we've developed a supervision policy for staff, that just to make sure that we're providing that, and we've put a big focus on well-being within that supervision policy. So instead of going straight to case discussion, you're part of what we've got a structure now around. You're asking about somebody's well-being, you're asking how they are and how they're coping before you go into the actual case stuff. That's next down the line. So that whole supervision policy that's been developed this year, and it's hot off the press actually, and it was developed from staff. We went out to staff to say, what's important to you here, that you get, what's important that you get out of supervision, what are you looking for? So it was developed from that end, rather than us saying, here's what we're going to renew and review our policies. So that's just an example of some of the work we've been doing recently. And I think Laura's team, Nikki, there's a wellbeing, they do wellbeing stuff that goes out to staff repeatedly. Nikki puts that out regularly. So there's quite a lot of things going in, because without our workforce we're nothing. And so it's important to keep them well.
Thank you, Isabel. John?
Yeah, thank you, Shameen. I think doctors are traditionally a difficult bunch to look after. They're not very good at looking after themselves, and we do need to be better at that. There's no doubt about it. I would say that over my 30-year career as a doctor within the NHS, the last year has without a doubt been the most difficult, and I think I agree. Have lots of support networks in place and are generally able to, despite what I said a moment ago, look after their own well-being. But I think one of the most important things is about being heard and knowing that the concerns that have been escalated and explained today in this paper and are being discussed on a regular basis are being escalated appropriately through meetings like this to the IJB and upwards further to our elected representatives in government and NHS Lothian and our partners in the council as well. So I think when you're not being heard and when your concerns are perhaps not being listened to, that makes it much more difficult to cope with the stress. So making sure that we as an IJB do take this forward and escalate those concerns appropriately, I think is probably the most important part of looking after our colleagues' well-being. Thank you.
Thank you, John. Councillor Jardine.
I think Sarah had her hand up before me.
Sorry, Sarah and then Councillor Jardine.
Okay, thank you. I think I echo what my colleagues have said, but I think for me what's really important with our staff is we continue to develop them, because that's when they feel that their well-being is looked after, they're being invested in. So it's key in the midst of all of this that we continue to look at the education of our staff to make sure that we've got a skilled workforce and that they are feeling invested in. So we have a responsibility to support that as we're able to as well. But I think for me, it's then also making sure that we continue to be an attractive place to come and work so that people want to come to work in East, because we are looking after our staff and we are developing our staff as well.
Thank you. Thank you, Sarah. Councillor Jardine.
Yeah, I just want to say, you know, kind of, I stumbled into this conversation, but I am heartily reassured by all the positive elements that have also been highlighted that maybe weren't necessarily in the paper, but we've certainly discussed them. I think the fact that we are able to continue to prioritise check-ins and supervision with staff members is going to be critical going forward. I don't think you can ever underestimate how important it is for each and every member of staff to be seen as an individual and a valued individual within that. And I think I commend all the managers within the system as well for continuing to find that time when everything is so pressed. I completely agree with what Leslie was saying around the multidisciplinary work, and there's huge power in doing that, not just from the perspective of what you can get done, but that ability to share professional perspectives and realise that you're part of that much bigger system and team. Chair, your comment around making sure that this paper is also flagged up to those, and John highlighted it as well, taking forward this paper as evidence in terms of our discussion elsewhere as well is going to be really important. So thanks to everybody for that.
Thank you. Just want to check if anybody else had any comments or questions. I don't see any hands up. Just finally, I just want to say, Isabel, I think you're absolutely right. Without our workforce, we are absolutely nothing. I think just for today, we want to just reassure you that we hear you, we hear you, and we take on board everything that's in the paper. We recognise the challenges that you face. We've had a decade of trying to manage while our budgets have been shrinking, and this is a consequence of that. I think it's also really important that clearly from the IJB that you're all valued for what you do. We know that you make a huge valuable contribution to the local community, to the whole system. And at the last NHS Lothian board meeting, when we were talking about rescheduled care, I said I want you to make sure that you recognise the work of IJBs, the work of social care, social work, and health professionals within that system. We're part of providing the solution. So I want to make sure that you pass that on, all the managers pass that on, that we hugely value what you do. And I have regular engagement with health and social care staff on behalf of constituents, and the level of dedication and commitment and kindness that you do your job to support that individual that is going through a crisis and needs that support to be able to keep going. I really appreciate that. And I know my one example is times, hundreds and hundreds. So, and as for today, it's our responsibility now as IJB members and as chair, and I've been, as you saw in my report, is to make sure that your voices are heard at every opportunity. So one of the things we talked about earlier was writing to the Cabinet Secretary, and I think it's really important we relay your views in that letter to him, to say, well, look, these are the workforce. This is the workforce that is required to support the system that's in huge challenge, and by supporting staff and being funded fairly, you know, it is possible to turn that around, but only with the support of all our partners and with the support of government, because we all came in here in this work to make a difference to people's lives, and that is now hugely being challenged every single day. So I'll take that forward to make sure that that does happen, and you'll know from our chair's reports, which I can make sure that I provide the appropriate feedback to pass that on to your staff. So people who feel that they have contributed to this report put their voices forward, and said how they felt that their voices have been heard and they have been taken to the appropriate levels, and we will be asking for feedback and actions of what they're doing to support us in East Lothian. Okay. On that note, on paper 9, there's a roll call, so I'll pass that on to yourself, Fiona Curry.
Thank you, Chair. The recommendations are set out in section 2 of the report. Shmeen Akhtar.
Agreed.
Jonathan Blaisby.
Agreed.
Patricia Cantley.
Agreed.
Andrew Cogan.
Agreed.
Jeremy Finlay.
Agreed.
Elizabeth Gordon.
Agreed.
Lynn Jardine.
Agreed.
Carol McFarlane.
Agreed.
Thank you. That's the recommendations approved unanimously.
Thank you. Move on to paper number 10, which is the best value annual compliance report, and that's with yourself, Duncan.
Thank you, Chair. The purpose of this paper is to examine the compliance with the duty of best value that applies to the East Lothian IJB as a public body constituted under the Local Government Act 1973. I'm presenting this paper in my capacity as the Chief Internal Auditor to the IJB, and whilst I was involved in authoring a number of sections of the paper, it was originally completely written by David King before he retired from the interim CFO role, with much support from Claire Goodwin, and they're reflected in the paper. I'd highlight the following aspects of this paper. The duty of best value is further explained in section 3.3 with relevant duties on the IJB, including the duty of best value, the duty to observe proper accounting practices, and the duty to make arrangements to report to the public on the outcomes of functions. Section 3.5 indicates the 7 broad themes against which the IJB can and has been assessed in 23-24 performance in Appendix 2, being vision and leadership, governance and accountability, effective use of resources, partnership and collaborative working, working with communities, sustainable development, and fairness and equality. In section 3.7, there are 10 key prompt questions as guidance from Audit Scotland, specifically for IJBs to consider. And Appendix 2 provides both an assessment and a template of how we would intend to take forward annual appraisal against these 7 broad themes, with the expectations that this would be future reported in June to the Audit and Risk Committee to align with the timescales of reporting for the annual governance statement going forward. Based on the approval of the recommendations in the paper by the IJB board today that would go forward, I would indicate that this template reflects the good work being taken forward by the IJB under all 7 of those broad themes, and open that up for questions.
Thank you very much, Duncan. Do you have any questions or comments for Duncan? Jonathan?
Yeah, thanks, Duncan. I guess just a few things. I guess I'm just trying to understand sort of the overall governance here. So this is, you know, legislation there is in relation to local authorities, and I think the Accounts Commission does an annual review, I guess, of the annual report. So there's an external review of this, but that's not the case for the IJB. So I might have using clumsy words here, but this feels like this is marking our own homework. This feels like to me, and so I'm a bit unclear whether really we should be heading towards more of an external review and assessment, or if it's not external, the likes of yourself through internal audit would normally have a scope of work to conduct on our behalf with a clear scope, direction, who you've interviewed, what information you've looked at, and then coming up with a conclusion, a recommendation, and recommendation, quite importantly, recommendation in terms of areas where we need to get better. And I don't see that in the paper here. It seems to be kind of with respect, kind of quite a positive outlook on what we've done to sort of, and so I guess I'm just trying to step back a little bit here to understand. Wasn't part of the previous discussions, I don't think, in terms of how we got to where we are today. And maybe this is just a first step, and I apologise if that's the case, but I just wanted to sort of get that background quickly, if possible, just to make sure that when if we are approving this, and we've been asked to basically say yes, we comply with best value legislation, but really that's appropriate for us to make that call, an assessment. Sorry,
Okay.
I don't know if that makes sense.
Yeah, thank you, Jonathan. I'll pass on to you, Duncan.
Yes, so really what you're being asked to approve at the moment, that would be our self-assessment as the IJB, and the intention is to do that self-assessment through to Audit and Risk Committee on an annual basis in June, so that we can reflect the what's happened in the previous year. A lot of this is actually included within the annual governance statement process anyway. Now the annual and this would then feed into the annual governance statement, which appears in the IJB's accounts, and then that is externally audited on an annual basis by Audit Scotland at the moment, who will do an assessment of best value against the IJB as well, so that they will be providing that assurance level. But this is a self-assessment to say, have we got everything in there that we should have, and is there anything that we would potentially then improve? And that will happen as through the governance statement, which does contain areas of improvement on an annual basis.
Okay, so it's clear it's a self-assessment. In terms of those development points then, and where we could do better, I wasn't sure that maybe I didn't read it closely enough. I wasn't sure if I saw those points.
Not really there aren't any in this particular assessment, and I think it is actually a positive assessment, but equally it's referring to the 23-24 year. I think when we bring the one through in June, there may well be areas for improvement in this current year that we would be looking at, albeit that I would suggest probably not, there's not going to be a long list, but there may well be a short list of improvement areas that then come through on that.
Okay, thank you.
Okay, does that help to answer your question, Jonathan? Okay, thank you. Councillor Jardine, and then Councillor McFarlane, and then Andrew.
Thank you. I'm kind of struck by the incorporation of all of the duties in the paper, and I note that you say, as we have no trading accounts, this duty doesn't require. But I suppose it got me thinking around some of the accounting differences that we have across the partnership. So we've got, the council sets a balanced budget for the beginning of the year, and maybe does adjustments as it goes along, whereas within health we're looking to balance the budget at the end of the year. I just wondered whether there was any, in your professional judgment, any scope for that difference creating issues around achieving best value.
I can see those differences creating tensions when you're looking at financial positions specifically, but however, best value, I think, probably in terms of then looking at the approach that we take to items where we're trying to provide that best value element, which looks at the outcomes that are being provided to the citizens within East Lothian. Actually, no, I don't think those two in specifically would create a tension in respect of providing best value, because that kind of transcends that very narrow accounting difference.
Okay, thank you.
Okay, thank you, Duncan. Councillor McFarlane and Andrew.
Right, I'm just asking what steps will have to be taken to ensure quality of care is not compromised.
I'm assuming, Carol, that's in respect of achieving best value. I would say that quality of care has got to be at the front of that in terms of providing best value. That's, if we're not providing quality care, then we're not achieving best value, I would suggest.
Right, thank you.
Fiona, did you want to come on this point?
Yeah, it's a helpful point, and I'm sure a surprise to Duncan being asked about the care, but I suppose part of it is the conversation before around what we are raising around the challenges in providing care, as well as the aspects that we are taking around that grip and control, and then recognising the statutory responsibility that comes into that of we do need to provide care and there is a cost, and we don't want to compromise people's safety and the level of care they get. But again, just the background of the scrutiny and the operational focus that's on the back of that. I don't know I suppose I'm conscious that we had quite a long rehearsal of through the professional leads paper before, but hopefully Councillor McFarlane, I think that was it, that helps just answer that question.
Yes, it does. Thanks.
Okay, thank you, Andrew.
Yeah, I think in terms of the scope of this work, I've no real issues, but in terms of understanding best value, in terms of the wider, are we getting best value in East Lothian? You have to do some form of benchmarking and comparison to others to see where we are aligned, and is there work that we can share with others about where we have good services, and vice versa? Can we learn from others? And I'm hoping that as this work progresses and develops, there may be areas where we can learn from others if there is better value in how services are provided elsewhere, and vice versa. It might be out of the scope of this piece of work, but as an IJB, I would always want us to be wanting to learn are there more effective and better ways of doing things, and vice versa.
Duncan, did you want to come in that one?
Yeah, I would say that there probably is work going on. There's always scope for improvement in respect of that, and a lot of our performance reporting has from the IJB also has that focus within it to benchmark against that. But certainly as a board member, I would always be encouraging you to ask those questions around that, and I do see demonstrable elements where those questions are asked and answered in terms of where we're at, but continue to do that, and that then provides that proving of best value, I think.
Okay, thank you. Carol, did you want to come back with another question? It's okay. I know that Audit Scotland provide lots of really good guidance and support in questioning and etc. If there's anything else you think that'd be helpful to IJB members, then please pass that on. But I'm also mindful of the improvement service who are carry out pieces of work. Is there anywhere that you would suggest where you're getting that analysis of how we benchmark ourselves with others? And then I'm also very mindful that sometimes you're comparing apples and pears, because our level of funding per person is one of the lowest in comparison to others, and then when you're comparing that makes it a little bit challenging. So there was that. And on page 138, it was around board meetings held in public. That was one of the areas that you've put in your report, and just how we take that forward, because I know at the moment we have to email in to request to be sent the link, so that's something for us to take forward of how we make them public.
I'm not sure whether any others want to come in around some of those benchmarking. Obviously, there are national indicators, and there's that are taken through, and there's benchmarking that's taking place in respect of those. But equally, I reflect your comments in respect of the funding for us per person, and in respect of the open to the public. If there's feel that there's any further need for promoting the public coming in, then obviously can look at any suggestions in respect of that. But obviously the meetings are also available online for people to view, both just after the meetings as well, which adds to that public scrutiny capability.
Okay, thank you. And David Hood?
Yeah, just to come back and support Duncan there in terms of some of the benchmarking stuff, and picking up on Andrew's point in that we do participate in a series of benchmarking pieces of work. So whether it's the local government benchmarking framework, and we've also had a recent presentation with and workshop with the improvement service, just from an East Lothian Council perspective, to look at the services and how they can support and target that kind of independent benchmarking and work across the services that we deliver, and also partner organisations across Scotland, to see how we compare. I think it's probably a wider piece of conversation, and at some point more than happy to kind of pick it up and bring back some of that wider kind of benchmarking how it shows, and whether that's through SPG or the right forum, very happy to do that as part of that kind of conversation.
That's great. Thank you, David. Andrew?
I'd just welcome that, David. I think getting that assurance to IJB members at the appropriate time and place, I think will be really helpful, and thanks for that.
Okay, thank you. I don't see any hands up or anybody else wants to come in to comments, so we'll move on to the roll call with Fiona Curry.
The recommendations are as set out in the report. Shameen Akhtar.
Agreed.
Jonathan Blaisby.
Agreed.
Tisha Cantley.
Agreed.
Andrew Cogan.
Agreed.
Jeremy Finlay.
Agreed.
Elizabeth Gordon.
Agreed.
Lynn Jordan.
Agreed.
And Carol McFarlane.
Agreed.
Thank you. That's the recommendations approved unanimously, Chair.
That's great, thank you. Move on to agenda item number 11, which is the finance update 24-25 and initial outline 25-26. And I've got Fiona Wilson for that.
Thanks, Chair. It's actually going to be Mike Porteous who's going to present it.
Welcome, Mike.
Thank you, Chair. Afternoon, everyone, and nice to meet you all. Hopefully you've had a chance to read the finance paper. It's not a long paper, but it does try to cover a lot. So I'll take you through the key aspects as quickly as I can, and I'm happy to take any questions at the end. The paper serves several purposes. It updates the IJB on the forecast outturn position for 24-25. It provides a high-level update on the recent Scottish Government draft budget, together with an outline of the financial projection for the IJB for 25-26. The paper also highlights further work that's required to allow the IJB to set a balanced budget for 25-26, the concerns around achieving that, and the actions proposed. And last but not least, it updates the IJB on the status of the 23-24 annual accounts. So we'll just go through the paper if that's okay.
Yes.
The first few paragraphs give some background and highlight the importance of regular and up-to-date financial information for the IJB in terms of managing the in-year and future years' financial position. Paragraph 3.4 confirms the actions already agreed by the IJB in relation to addressing the current year forecast overspend, and that was to release the reserves and offset the overspend against the health aspect of the budget. And that leaves in terms of an update, the IJB has a remaining forecast overspend of roughly 2.8 million, which sits in the social care position. And we are required to work with our partners to identify recovery actions against that overspend and address the gap. So that will be one of the first things that I will set out to do over the coming weeks. The next paragraph set out the key outcomes of the Scottish Government draft budget for 25-26. Overall, there are a couple of comments it's worth making at the start of this bit of the paper, just to put things in context. As with most of the things that come out from the Scottish Government, the devil's often in the detail. So the 2.1 billion that's identified as additional funding for the health sector, 1.6 billion of that is making good money that the health sector got in this current financial year. So it's not new money. It's making good the new money that we got this year, or making recurring the money that we got this year. So that leaves a roughly £500 million across the whole of Scotland, for which will fund about 3% uplift. In terms of the council settlement, identifies 289 million of additional funds in there for local priorities. There are a few elements of the budget that differ from the planning assumptions that were used in the estimates of our 25-26 outturn, so it's worth covering those over in the next bit of the paper. In terms of the health budgets, health are to receive a 3% uplift on their 24-25 baseline. What that means is a 3% uplift on pay and non-pay budgets. The assumptions in the financial plan to date have been uplift on pay budgets only. So there is a little bit of additionality coming through the health sector in terms of the non-pay side of things. The draft budgets also indicate that additional costs arising from the changes in staff terms and conditions will be fully funded, and also the impact of the increase in national health rates for directly employed staff will be funded. Whilst that doesn't change the position for the IJB, it does make things a little bit clearer. And just to remind everyone as well, in terms of these uplifts, the expectation is that whatever is due to the IJB will be passed through to the IJB, along with the funding for the real living wage and the personal and nursing care, free personal and nursing care, I beg your pardon. In terms of the local authority budgets, the impact is a little bit less clear. There is the additional funding of 289 million, as I mentioned earlier, but at this stage, there's not the same clarity around the impact of the national insurance, the increase in rates, in terms of council costs and third sector costs. So there's work to be done to understand that on a local and on a national basis. But the announcement did make it clear that there's no funding in the 289 million for that national insurance increase. Any expectations around that will come from any money that comes from Westminster over the coming weeks and months. So I really need to point out in that case that there is a risk that there's going to be some pressure that comes out of these budget changes, but we won't know that until we work our way through all the detail, and that's locally and nationally. So that will take time. Excuse me. So in terms of the announcements, we now require our partners to run the budget outcomes through their financial plans, and we will provide an update to the 25-26 financial forecast as soon as we have that information. Excuse me. The changes are unlikely to bring the projected overspend of around 9 million for next year down substantially. So recovery schemes that are being considered will need to be discussed with partners as an ongoing piece of work. Paragraph 3.9 proposes to have a workshop to agree the recovery plans before the March budget setting meeting, and it highlights the main schemes that are being looked at the moment. And in summary, those are a review of the internal bed base, including the set aside and the hosted service bed bases, further review of commission services, workforce review, and also looking at ways in which the Health and Social Care Partnership can maximise its income going forward. So the outcomes of these reviews will feed into future iterations of the recovery plans. And the paper goes on to highlight some of the risks that are arising from the draft budget and also from the current operating challenges that we face. Those being the impact of the Scottish Government budget announcements and the impact of the UK Government's announcements in terms of increasing the national insurance rates, and the environment that the health and social care services find themselves operating in. So there's a lot of work to be done to understand the extent to which these risks impact on the IJB, and also in terms of managing these risks going forward. The last paragraph of the paper, paragraph 311, shares the good news that the IJB's 23-24 annual accounts have now been signed off and are now available on the IJB website. That was a quick canter through the paper. In conclusion, the paper makes a number of recommendations, which I will just go through with you. So the IJB it recommends that the IJB note the projected outturn position for 24-25, note the output from the Scottish Government draft budget for 25-26, note the outline of the financial position for 25-26 for the IJB, agree to write to the partners formally outlining the financial and operational challenges and seeking further discussion with both partners to agree a way forward to a sustainable financial position for the IJB. Agree to a further finance workshop to fully consider proposals to manage the 25-26 financial position. Note the risks laid out in paragraph 3.10 and note that the IJB's annual accounts for 23-24 have been approved and signed. I'm now happy to take any questions.
Thank you very much, Mike. I'll open that for any questions and then comments. Mike, could I just ask for clarity? Just the top of page 145, you'd mentioned that there's the NHS have got a 3% uplift for pay and non-pay. And so what I just wanted to, so I'm just really clear on my understanding, and what it says in the paper is the settlement is clear that an appropriate share of any NHS uplift will be available to the IJBs. So it was an uplift for the NHS and for the IJBs together.
Yes, yeah. The uplift will be passed through to the IJBs in terms of the services that are delegated to the IJB.
Okay, and is that Scottish Government guidance that will be passed on? Is that just a given?
I'm honestly not sure if it's guidance. I would imagine
Okay.
it is, in terms of the expectation is that you find it difficult to run your service. IJB will find it difficult, and the Health and Social Care Partnership will find it difficult if that's not passed on. The pay is always more or less a given, in the sense that it will be passed on, and the non-pay, it should be passed on as well.
Okay, that's great. I'd find it really helpful. I know David King's done that for us before. It's just getting Scottish Government guidance wherever it's appropriate for us. But on that one, I'd find that helpful. Okay, thank you. I've got Elizabeth and then Jonathan. Sorry, Fiona, did you want to come in on this one?
Yeah, I was just going to add, my understanding it's guidance, and NHS Lothian they have done in previous years, just pass whatever they get, they pass it through.
Okay, that's great, thank you.
And that I guess, just to reinforce, I have asked that question recently on the back of a question that came at council. So they have assured me in the last week that anything they get, they will hand on.
That's great, thank you very much. And Elizabeth and then Jonathan.
Thanks. Thanks, Mike, for the paper and explanation. That's great. My question is quite a general one, so I'm not sure if it would be for you or maybe for Fiona. But just wondered, in terms of the national insurance contribution and the sort of unknown element of the impact on third party providers of social care, have any of them been reaching out to officers with any concerns at the moment?
I'm going to bring Laura Kerr on this, because it has been a conversation. So Laura.
Yes, I think it's been noted, maybe at the SPG we discussed it, but yes, certainly our third sector providers are increasingly worried about the impact and costing the impact for their services, and we're just trying to work with them to look at how we can support them and what can be done, but obviously there isn't funding available for them. So yes, very difficult, and yeah, they have been reaching out.
Yeah, just Elizabeth, just to add to that, it was raised as an issue at the Volunteer Centre East Lothian annual conference. Maureen's not here, but she did raise that as a concern there.
Thanks.
Okay, Jonathan?
Yeah, just a couple of things. I guess, when we talk about this year's outturn and just being transparent with our partners, we have nearly a 3 million deficit. We've had conversations about this in a number of meetings. Honestly, is it even at all realistic to believe we can get anywhere near break even here? We seem to sort of language we use seem to indicate there is. You yourself, Mike, said you needed to look at this as a matter of urgency over the next few weeks. I would suggest that is the kind of the ship has sailed here for us for this year. Honestly, we've been talking about this for months, and here we are, and it's across the health and social care side of things. I don't distinguish particularly between the two in terms of where we are. We have a 3 million deficit for the whole of the IJB. It's not relevant to me, but it sits where it sits. Particularly, but are we honestly saying that we can find, or it's even what we should be doing to try to identify savings, but will fall into this financial year? And I'll put to you that I just do not see how that is realistic at all. That's the first question, really, or point. We'll maybe get to a bit of this in the private session. And also just encourage that to make sure we do have those development sessions, incredibly important, but we have those sessions at the IJB as soon as we can in next year, in terms of talking about 25-26, so that we can, if possible, really get to a really clear plan how we will get to break even next year for that and address that 9 million gap. I really hope that we're not sitting here talking in 6 to 9 months' time, having the same conversation saying we need to find 9 million or 6 million or whatever the number is. Of course, it's always just plans and proposals, but honestly, I think as a group, I feel we need to really be very clear before we get into the new financial year, in beginning of April, how we're going to get to that break even, and they may be unpalatable choices. We may not even be prepared to make those decisions. But that's my sort of view on that one. So I'll stop there.
Okay, Fiona, did you want to come in this one?
Yeah, and just because Mike's first session is today, so I think that's reasonable. I think part of the story we are trying to tell through the IJB and get it formally docked is the concerns around the in-year gap, which I would agree with you. We are going to struggle to break even. But as part of that, we have a responsibility as officers and as an IJB to keep at it around where we can make efficiencies and savings, but also to tell the story around we actually, and as an IJB, you have made difficult decisions before. There is I suppose an acknowledgement that we will make decisions, but it's balancing it with the risk. And I suppose part of the reason that we were keen, and Mike, as part of his paper that David had helpfully put together, is just docking this in your position. I think you're right. That is going to be struggle. We will struggle to make that, but as well as plans for next year. We've just heard about the professional leads paper. We are getting into decision making where it is really, really difficult, and there is impact, and we just want to use this process to make sure we're being really transparent around how we dock it, how we're having these conversations. And we've had some really challenging conversations as part of the development sessions, but it is important just to note this in the paper today. And I think you're being quite realistic, Jonathan, around where we find ourselves, but it doesn't mean we should stop around the work that we're doing, because we did speak around the monies that came in for additionality. That does also create opportunities for pump priming, potentially some work around transformation. But in year, I think that's a reasonable point. But we do need to make plans. Sorry, Mike, I hope I've not overstepped the mark with you as CFO.
Mike, did you want to come in?
Yeah, if you don't mind.
Yeah, of course.
I would just add, I agree with what Fiona said, but there is an importance around continuing with the work that we're doing. One is if we do come up with any more ideas, and when we do come up with ideas, it's about trying to future-proof some of the problems that we're going to have, or we look like we're going to have going forward. So if we can identify things now that we can start to put in place, or at least discuss further, then that's us heading down the right road, recognising that there's bigger challenges ahead. And the other thing is we have to demonstrate that we've exhausted all sort of avenues, especially when we come to make some of the difficult choices that we may have to do in the future. So it is about making sure that we have done everything we possibly can in terms of what's available at the moment, and then how do we what are the difficult choices that we may have to make going forward to try and bring that position back in line, or making changes now that we can then have an impact on bringing the position back in line in future years.
Okay, thank you, Mike. David, and then Councillor Jordan.
Thanks. Once again, I find myself in unison with Jonathan largely. I'm a bit confused as to how we actually get from here to the end of the financial year. Now, we've got an option that we might exercise, but the question is, if we have a gap of about £3 million, and if, as seems to be the general consensus, it's going to be very hard to bridge that between now and the end of the financial year, despite us continuing to try strenuously to do so, what happens next? For example, if we're not able to bridge the gap, is there a date, the 3rd of March or whenever, when we run out of money? Or do we just roll forward the deficit to next year and not make a balanced budget, and therefore we're in an even worse starting position for the next financial year? I would love it if someone could very simply say, if this happens, then that's what we do, and sort of step between now and the end of the financial year as to what our sort of option lines are. Is that possible?
Fiona, did you want to come in on that one? And
yeah, so I was partly coming at the start, just around this is the so what we need to do is be transparent with our partners around saying we have a challenge, and how do we communicate that with them? Because what I don't want, and we have discussed this, is there to be a surprise for our partners, because it will go to the partners to pick up. So part of this and docking it is to start that communication and conversation, and informally they are aware, but it's important to us as an IJB that we're transparent and around all the actions we're done and the steps we'll take. So I think that was partly reflected in the recommendation. I guess the other ask that as we want to do as part of this process is recognising the funding is not sufficient, even with all the things we're doing. I suppose it's just what is the offer from partners for future years as well, and have that as part of the conversation. We can outline all the steps, and we have done in development sessions that we're taking around grip and control. But I think it's the point of, I am keen as Chief Officer that I'm not leaving it till March to inform formally our partners, and I think that would be the direction as CFO. So I'm hoping I'm answering your questions. The reason we're bringing it now is to enable that conversation earlier.
Yeah, I fully understand that, and it's absolutely the right thing to do. The question I'm asking is, what happens if we don't succeed and there is no relief coming from anywhere to bridge that gap? How do we deal with that gap between now and the end of the financial year? Do we carry it forward? We're not allowed to do that, I don't think. Or do we have to make some sudden cuts, or what are the options to us?
So to make sudden cuts, that's then the challenge of the risk of we bring harm to people. So that's why we have to start the conversation. And the professional leads would not be recommending, and either would I, with that responsibility for people and what we set out in the statutory of do no harm. We cannot stop services where we think where we are going to bring harm. The responsibility then will fall to the partners and to support us in the short term.
Right. Okay.
David, did you want to come in on this point to help, David?
Yeah, so I think Fiona just answered it there in the last sentence. So ultimately, David, this is governed and covered by the integration scheme, and the funding that we get is from our partners. And if at the end of the year we have an overspend, then that is governed by the rules in the integration scheme and goes back to those relevant partners, which is why I think what we're saying is we need to be making sure that those conversations at an early stage have been happening, and they have been happening, but formally recognising those to our partners so that they don't get landed with a bill that they have to pick up unexpectedly at the year end.
So the answer basically is de facto we have a funder of last resort.
Yes, but that obviously then puts pressure on whether it's NHS Lothian or East Lothian Council. Yeah. And it's not something that we should just rely on to say somebody will come and bail us out, I think is the point that Mike and Fiona was saying. Yep.
Okay, does that help to answer your question, David?
Yes, thank you.
Yeah, I suppose one thing is that that this finance report, there are minutes of our meetings of IJB meetings go to the NHS Lothian board. So all the papers that we've had on finance are part of NHS Lothian board papers, and that's for all IJBs. And then from the other partners' perspective, we get East Lothian Council finance updates, and there's a section on the IJB, and that outlines what the gap is, where is that gap coming from, what's been done to address that gap. So over the year, those are the things that are happening with both partners. And then from the last meeting, we had quite a lengthy discussion with David King, who outlined ongoing conversation with David King and Fiona Wilson and both partners as well. I suppose that's important to highlight. Okay, Councillor Jardine.
Thank you. I suppose I'm kind of focused on, because we've had a really good discussion about in year and what we do towards achieving a balanced budget at the end of the year. In terms of next year's assumptions, I'm curious about exploring the context around the 3% uplift that the NHS have been identified, given that it's probably the only thing that we know is confirmed. I wonder how that compares to any assumptions we were already making around next year's staffing budget, given that staffing is the biggest part of our expenditure.
Can I answer that?
Yes, please.
Yeah. So my understanding, and I haven't seen the detail of the financial plan for next year, but my understanding is that we would be assuming that pays were funded, pay uplift was funded.
Okay.
So what we've been given is 3% at the moment. And the pay awards haven't been agreed for next year. So if the pay awards come out at 5%, the expectation from a health perspective is that the funding for that difference between 3 and 5% will come as an additionality next year, if that makes sense. So
okay.
there is always an assumption, or not always, but there is usually an assumption that comes through discussions with Scottish Government throughout the year, and then giving us sort of a guidance on where they're heading. There's usually an assumption that pay will be funded. So my understanding is that we've assumed that in the plans for next year, but we will assume it to the level of 3% now, not beyond that until we know what the actual figures are. Does that make sense?
Yeah, that makes sense. Okay, thank you.
I don't see any other hands up for any other questions. Thank you very much, Mike, for following up David King's paper. The only thing I wanted to add was around prioritising our resources and where we spend our resources, and transformation, and how we're linked in to both partners' transformation work to help us as we move forward, and also the Audit Scotland report that highlighted the requirement for reform and change of both health and local authority services. That might be a paper we might want to share amongst IJB members, and maybe possibly have it on a future agenda. Okay, I don't see any other questions or comments. So this paper has a roll call, so I'll pass that on to Fiona Curry.
Thank you, Chair. The recommendations are set out in section 2 of the report. Shameen Akhtar.
Agreed.
Jonathan Blaisby.
Agreed.
Patricia Cantley.
Agreed.
Andrew Cogan.
Agreed.
Jeremy Finlay.
Agreed.
Elizabeth Gordon.
Agreed.
Lynn Jardine.
Agreed.
And Carol McFarlane.
Agreed.
Thank you. That's the recommendations approved unanimously, and that's the end of our public business.
Thank you. I'm just conscious of the time that you've been scribing, Fiona, so if we could take a 5-minute break. I know lots of people will not, because the next section is